have one like belly next to the thing to get rid of. Yes. Washington and Florida.
Okay, all right, we have called this meeting, to order at 7:08 p.m. As I mentioned a moment ago, we have a long agenda. We're covering a lot of important topics tonight. Appreciate the fact that my committee members are here. I want to introduce my assistant chair, O.C. Kaminer, my other committee members, Carmen Paulino, Jacob Banis, Heidi Guzman, and somewhere in the stratosphere we have Richard Allman. And we may in fact have Richard Allman may in fact appear in person, and we may have one other committee member joining us. But we have an ample number of committee members here, enough to proceed. And so I want to be, I was hoping, by the way, to have a presentation tonight by the Borough Commissioner from the Department of Environmental Protection, a special presentation he refers to as Flooding 101, dealing with flooding issues, resiliency, mitigation. But since we have so much other stuff to cover tonight, I put it off till our next meeting, which will most likely be on September the 4th, around Labor Day. Come back to us for that presentation. But tonight we're going to begin with an annual report that we request from our local EMS base station, number 13, which is over on 173rd Street and Amsterdam Avenue. Now, is it 173rd or 172nd? It's 172nd and Amsterdam Avenue. It's important to us. I like to mention every time that this community board advocated to have that EMS station located within our community. Some time ago, it was located down in Harlem, and we wanted to see it right in our community in order to save transit time between our community and Harlem, so we can have the ambulances right here in our community. So we're always glad to have a representative from EMS Station 13. Tonight it's Lieutenant Miguel Cornier. Am I pronouncing it correctly?
I can't hear you.
Yes, you're pronouncing it correctly. It's Lieutenant Cornier.
Okay, very good. Lieutenant, we're interested in hearing about how our local ambulances have been doing, the workload that you've had last year and this year to date, what the response times have been, and also we're interested in knowing whether or not we've been able to get a handle on the issue concerning the turnaround times at the emergency room here at New York Presbyterian, which has been an ongoing concern of ours, I believe, as well as yours, to try to get the EMS units in and out as quickly as possible so that they can go back on the street. So let me turn it over to you. Let's hear your report.
Well, I want to start off by saying thank you for having us. Good evening, everyone. My name is Lieutenant Cornier. I hope everyone's doing well this evening. Pardon me if I'm a little bit nervous. My first time doing this. I'm a fairly new lieutenant, kind of just been promoted last year. So some of the concerns that we have are indeed the turnaround times. The turnaround times at Hospital 17, which is Columbia Presbyterian, is averaging around 40 minutes, give or take. We would like to get that number down a lot to the 20-minute mark. So what we've been doing at Station 13 is whenever there's an extra lieutenant, we are putting them in a position of conditions 6-6, which is an administrative position. They'll sit in an ambulance and they'll go in and they'll assist the units in expediting out of the ER. Some of the things that we go in and do, we'll go grab some stretchers, try to help the nurses out, try to help the PCTs out there. We'll do blood pressure and just kind of help with the workflow. Even though that's not in our scope of practice, we want to get our ambulances back in service as quickly as we can. Another thing that we've been doing to kind of reduce our response times in the community is we've have 13 John, 13 Frank, and 13 Adam. Those are all new units. They all started June last year. They run 12 hours. 13 John is from 9 to 9. 13 Frank is from 8 to 8, and 13 Adam is from 10 to 10. So these things have been helping. I'm sorry.
Is that those are the terms you use for particular ambulances?
Yes, so 13 John, 13 Franklin, 13 Adam is their essentially like a call sign. Those are the units that are assigned to the community.
Okay. Okay.
Say again?
No, no, I just wanted to make sure I wasn't getting, we're not talking about people, we're talking about vehicles.
Yes, yes. Sorry. Yes, those are the actual physical units.
Okay, very good. Okay.
Last year, June, we got a new PRU pilot program that was implemented in Washington Heights. The pilot program is called P13, which stands for Paramedic Response Unit. It's essentially staffed with 2 paramedics, highly trained. They essentially bring the emergency room to patients' homes. That pilot program is doing phenomenal. They're unable to transport patients, but they do get to the most critical patients quickly. And they're also, whenever they respond to an assignment, they're responding with a BLS ambulance. So it'd be 2 paramedics and 2 EMTs responding to one call. If the patient is deemed a low priority, not needing paramedic interventions, that patient is then transported to the hospital via a BLS ambulance, which is equipped with 2 EMTs. If that patient is deemed to need paramedics, the 2 paramedics will transport with the 2 EMTs to the closest facility. As far as some other things that we're doing, we're implementing, not really implementing, but on a station level, we're letting members pick up overtime to run spare ambulances. We run approximately 4 spare ambulances per week that are vary, whether it be 2 paramedic units or 2 EMT units, but we've been striving and pushing for that. There is some vacancies at the station level, but with us helping, motivate the members to pick up this overtime, it has helped bring these numbers down and the response times down and the turnaround times down at the hospitals. Our goal is to try to run as many ambulances as we can. And with these spare units coming in, it does improve the response times in the community. One more thing that we're also doing. Say again?
Yeah, go ahead. Yeah, I'm sorry. Go ahead.
One more thing that we're doing is we're advocating for the department to give us more members. There is another class of EMTs graduating June 13th. We're hoping to get maybe 10 members, but we're at the will of the department on that one. We have no say so on how many members we actually can get from the new class. There's also another paramedic class graduating June 26th, from my understanding, and we're advocating to get more members on a paramedic level to the station so that we can try to run more ambulances and staff more ambulances throughout the day.
So the on June 13th, the class, those are EMTs as opposed to paramedics?
Yes, so on June 13th, it's a class of EMTs they're graduating. They're essentially finishing out their rotations this week, and they should be done June 12th, and June 13th, they should be ready to hit the streets. My captain is advocating for at least 10 new EMTs to come to the station to help facilitate with our vacancies. That's the ideal number that'll put us a little bit above par so that we could, fit in the factors of members going out injury, vacation over the summer, people calling out sick. We like to be above par so that we can make sure that we run all our ambulances 24 hours a day.
Do you have anything more?
Yeah, so as of right now, with the PRU and with the implementation of Condition 6.6, the last report that my captain gave me was that our members are running on assignment 49% of the time. Our availability is 25% of the time, and our off service is 25% of the time. Off service being members being out injured or sick. Also, off service counts whenever we put an ambulance out to deep clean it post assignment. So, this job is forever evolving, and we deal with a lot of sick people. So we sometimes have to clean these ambulances throughout the tour whenever there's bodily fluids, so on and so forth. So our response times and our off-service times, we're at par We're looking really good in the community. We hope to try to get a new station. We definitely do need a bigger facility. The trailer it's working, but we're at the seams. With new members coming to the station, it kind of makes things a little bit difficult, but we're constantly talking to the department and asking to have them look for a larger facility within the community for us. So we're trying our best on our level as a lieutenant and as a captain to better serve you guys and serve the community. Our goal is to have coverage every 6 or 8 blocks, have an ambulance posted there. Ideally, that's what we would like, but it's difficult with the call volume being so high. We're responding to approximately 6,000 calls a day citywide, and the units are doing 10 to 12 jobs a day, so it's difficult. But we are trying to find different ways and creative ideas of how to solve these issues on a station level. Hopefully, the department agrees with us and we can get more ambulances and a bigger station so that we can reduce the amount of the time, our response times.
So maybe we should be, when we do our annual budget rankings, maybe we should be advocating to have a new station house for you.
I made that note.
You already made that. Yeah. Yeah,
We would love that. We would definitely love that.
Well, we review our budget priorities every fall, every October, really, and we come up with a new list of things we want in our community, and this is a good one for us to have on our list. It never dawned on me before. I knew that you were, breaking out at the seams there, but it never quite dawned on me that you were advocating for a new building. Yeah, we should pursue that. But you say that there are 6,000 calls a day citywide. How many do we have in our district?
That statistics is difficult to find. We're currently transitioning to a different software in order to give you the right numbers. I don't have that exact number with me, but what I can tell you is that due to the increased amount in call volume, members from the district, or ambulances that will be serving the district rather, are being pulled into the Bronx, the South Bronx, and over by Riverdale, and they're being pulled into Harlem, Central Harlem. So we respond based upon a matrix. That matrix just uses GPS and it pulls the closest available ambulance to that call. So it's kind of difficult for me to give you that number off the top of my head from my experience and being in the streets with the units. But what I can tell you is that the ambulances, the members are trying their best to stay within the area. But once they get pulled out of the area, it makes it difficult for them to get back to the area. So people in the community sometimes will be getting an ambulance that is coming from the Bronx or coming from a distance. So that's one of the major concerns that we have. But unfortunately, with the call volume being so high, it's hard to predict. Some days, we can have members in their area of coverage for their entire shift. Other days, they don't see the area because the call volume is so high and there's people in need everywhere.
Well, I would give you credit for whatever calls you respond to. I mean, if you're called away to an emergency in the Bronx or to Harlem, we don't have strict borders here. You're allowed to cross the border. You can go to another borough if you have to provide service. I have no problem with that. But I'm just wondering, the extent to which our crew here at EMS 13, the extent to which what your workload has been like. And do you have a number for your response times? How have you been doing on response time?
The exact number for Station 13 is something that I cannot get for you, unfortunately, because like I said, we're transitioning to a new data systems that are getting us our statistics. But what I can tell you is with speaking to my captain and speaking to the local chief that covers the area, we are at par about 8 minutes with the rest of the city. So it's a little slow. It's not where we would like it to be, but we are doing our best. There is a shortage of members at Station 13. We have about 4 true vacancies right now, which we're trying to fill. So sometimes we have to run down an ambulance. But a lot of members do step up and pick up the overtime. There are dedicated men and women that are trying their best. So we do get coverage, but that coverage only lasts about 4 to 6 hours, depending on the day. Sometimes we'll get members, they'll roll over, so they'll do their 12-hour tour and they'll stay another 4 to 6 hours. Other times we'll have members come in on their days off and they'll stay anywhere between 10 and 12 hours. So we are trying to reduce the response times by not only offering the incentive of overtime, but letting members know that they are appreciated in the community. So it motivates them to come in and work harder.
How many vacancies did you say you have?
Right now, we have about 4 vacancies
4.
on
Okay.
on the overnight predominantly. The day shift is fairly covered. It's really just the overnight where we're struggling. But with this new class coming out, we're planning to move people around and get all the vacancies covered.
All right, I hope so. This is the turnaround time at the ER has been a particular bugaboo of ours, mainly of mine. So, because when I first got wind of this issue, the turnaround time here at the ER was something like 32 minutes. So now you're telling me it's up to 40. So we're not going in the right direction. I'm looking at a newspaper article, by the way, that mentions that at 6 hospitals where the fire department launched hospital liaison teams to help expedite ambulance turnaround times in the ERs, ambulance crews were able to return to service 7 minutes faster. Is our hospital here one of those 6, do you know?
No, so Columbia Presbyterian does not want the hospital liaison unit there. They're a private facility, so we have no control over them. Unfortunately, we did present it to them. That's totally up to them whether they choose to accept our help and have so the way the HLO unit works is you have a sergeant, which is a new officer position, or a lieutenant there, 2 EMTs, and we'll take over the patients when EMS units arrive, and we'll sit at triage with those patients, and that'll help expedite units back in service. As far as the turnaround time at Columbia Presbyterian, Hospital 17, as we call it, which is on 168th, and Hospital 16th, which is up over on 218th, we can't control what the nurses do. We can't control what the PCTs do. So it's kind of difficult to expedite units when they don't want our help. It's something that the chief has spoken to them about. But if you guys can have a conversation with them and tell them that it's a great idea and it's working, maybe we can, as a unit, have them be convinced that, the HLO unit is important, especially to the community that we serve.
So what it's called, the HLO unit?
HLU, Hotel Lima Uniform. Yes.
Okay.
It stands for the Hospital Liaison Unit.
Oh, okay, okay. All right, well, maybe we should pursue that idea. I mean, hopefully it doesn't run into any union issues. Now, and the last question I have is, you're saying that the response time is generally around 8 minutes, which according to this newspaper article is actually better than the citywide average. This is an article that came out in late April. It said that this year the response time was at 12.35 minutes citywide, which sounds pretty bad. And it was up from 11.87 from 2024. So if we're doing 8 minutes, then that sounds like it's better than what the rest of the city is doing.
Yeah. So at Station 13, we definitely, myself and the other lieutenants, pride ourselves in motivating the members to get their response times down. Not only because it looks good, I won't lie to you, it does look good when lieutenants motivate the members and we get these response times down, but we actually care about the community. A lot of our members live in the community. A lot of our members come from the community. So we take pride in serving the community. A lot of our members, family members still there. My family still lives in the community. So for me, I take it personal when it comes to response times and the quality of care that we're pushing out of Station 13, and of a lot of the lieutenants feel the same way. So when I say that our response times are 8 minutes, I can say that proudly, that we are definitely working hard to serve the community.
Well, I tell you, we appreciate that. Anyone have any other questions? All right. Well, Lieutenant, you did well. You could tell the captain we're pleased with your report. We are anxious when you fix your computer system. We would love to see the actual numbers for the call volume and the response time. So maybe you can get back to us at some future point, maybe in the fall, and let us know what those numbers are.
Absolutely. I look forward to having these meetings more often. I believe you said September was the next one, correct?
Yeah, our next meeting is going to be on September the 4th.
Okay, so I'm going to try my best to get you those numbers before then. If I can, hopefully by the next meeting, I could get you those numbers.
I would appreciate that, and I want to thank you, and I want you to pass the word on to the other crews working out of EMS Station 13 that we appreciate the work that they are doing.
Not a problem.
Day in and day out.
Absolutely. I definitely will pass the word to the members. Thank you so much for your time and having me.
All right. So say hello to Captain Taylor for us.
Will do.
All right. Take care.
All
Thank
right.
you.
Take care. Thank you. Bye-bye.
Okay. Next up on the agenda, a familiar face from talking to us about the impact of the Trump administration's funding cuts on research at the Columbia University Irving Medical Center. Ross Fromer, Vice President for Government Affairs. Ross spoke to us just, I think, a couple of months ago before the Trump administration decided to claw back $400 million worth of grants. We didn't know at that time what was coming down the pike. I think it happened maybe just a couple of days after our meeting, but we knew that things were not looking good from Washington, D.C. So what I asked Ross to speak to is what exactly is in jeopardy. What is the research? What are the medical advances that we may be losing out on because of these funding cuts? So I'm hoping that Ross can fill in the blanks for us. Go ahead, Ross.
Well, thank you, Stephen. I did not realize that my last appearance was just a couple of days before we got the notice. I'm a little afraid to come back here because I don't know what the news is going to be the rest of this week.
There was yesterday, as you probably know, there was another threat that came out threatening to cut out Columbia's accreditation. I mean, every day another threat.
Yeah, let's just say it's not been a calm spring, put it mildly. Steve, I'm going to do this just for you for a second, just so you know.
No, you're doing it for my entire committee.
Okay, so you see, I got the Barcalounger in the background.
Oh, I appreciate
the
that.
Couch in the background. I know you like that, but the more professional look and put the background.
You're showing off the Archie Bunker, your Archie Bunker studio effect there.
Yes, it is as comfortable as it is ugly. So, and my wife is yelling at me. Yes, I agree. Yes, I agree. So I did do some slides, and I'm going to warn you. Steve wanted a simple presentation. I said, no, I need to do something a little bit more complicated than that. So, what are you seeing now? Let me just start this here.
Well, we have the slide that says budget reconciliation.
Okay.
And now we have one that says federal support of research.
Are you seeing just that? Or are you seeing the presenter slide as well?
No, just the federal support of research.
Good, perfect. That's where I want to be. So, again, thank you, Steve, and members of the committee for asking me to come by and spend some time with you today to talk about what's happening with research at Columbia. And I will be upfront with you. There's a lot I'm going to talk about here today, but there's a lot I can't discuss for various reasons, just some very sensitive things going on. But before I get to some of your specific questions, I did want to set the stage a little bit about research in this country, research in New York, research in America. And you can see that each year in FY24, basically the federal government spends $200 billion on research. They are by far the largest funder of research in the country. My guess is, I don't know this, is the largest funder of research in the world. You'll see that 46% of that comes from the Department of Defense, but I should note that a good chunk of that, and I don't have a number, is actually what you might think of as civilian uses. DARPA, medical research, dual use opportunities, things that, while certainly benefit the military, can also have the potential to benefit you and I and everybody else in the country who aren't serving in the military. Among the other 54%, you can see the Department of Health and Human Services is a majority of that, but several other agencies support research throughout the country. And this could be everything from basic research, studying the inner workings of cells, to translational research, to clinical research, to device research, to patient outcomes research, across the board of the research scheme. In New York State, about $4 billion each year in non-defense research funding. As many of you know, I used to work for Senator Moynihan, and he used to issue a report each year that showed that New York was a net donor state to the federal government. We paid more in taxes to the federal government than we as New Yorkers received from the federal government. Research is one of those areas where that does not hold true. The one set of figures I know is with the National Institutes of Health. For instance, New York is 6% of the population. We get somewhere around 10% of the NIH funding to this state. In New York 13, in this congressional district, 1.15 billion in research. I believe that's in FY24. Obviously, Columbia is largely responsible for that, but we also have Mount Sinai in this district. We have CCNY in this district, Teachers College, CUNY School of Public Health, others that contribute to this number. I did check. New York 13, Congressman Espaillat's district, is third in the country out of 435 districts in terms of NIH funding. I believe it's the Boston, which has Harvard and there's one of Massachusetts, which had Cambridge and Boston, Harvard, MIT, etc. And then a district in North Carolina, which includes Duke, North Carolina, UNC, with the so-called research triangle. I was very pleased to find out, and a little surprised, I will say, we actually get more NIH funding than the district below us, New York 12, which has Cornell, NYU, and several other leading institutions. I thought they would have more than we do, but no, we do have more. I should note, a little plug, I should say that ever since he came to Congress, Congressman Espaillat has been a huge supporter of NIH research, and especially now he's on the Appropriations Committee. The other areas which you tend to see if you look is in Baltimore, Seattle, Philadelphia, and San Francisco are the other leading research centers in the country. A little bit about research at Columbia. Last year, $950 million in research. That's across the board. That's about 15% of the overall Columbia University budget, and that's by expenses. A large majority of that is from the federal government. There is a small amount of state research. There's some private funding, some venture capital, but a good chunk of that $950 million is from the federal government. The leading agencies, National Institutes of Health.
Is that an annual number?
That is an annual number.
Oh my God.
Centers for Disease Control, National Science Foundation, Department of Defense, Department of Energy, NASA, and something called the National Oceanographic and Atmospheric Administration, which looks at things like weather patterns, ocean tidal, and whatnot. Obviously, up at the medical center, NIH and CDC are some of the biggest funders. Down at Morningside, it's the National Science Foundation, Department of Energy. And then up at Lamont Doherty, up in Rockland County, we do a lot of NASA and NOAA research as well. But there is crossover. We have NSF money at CUIMC. There is NIH money down at Morningside. Columbia, as a whole, gets about $500 million plus a year from the NIH. Most of that is up at the medical center, but not all of it. And that does not include probably another $50 million or so, which is essentially going to Columbia, but works through something called the Research Foundation for Mental Health, the New York State Psychiatric Institute, which is, although affiliated with us, in our psychiatry department, is a separate state institution. So all totaled, if you add Barnard, you add Teachers College, you add the Structural Biology Center, which we are involved in, you're getting close to, maybe not quite at $600 million in NIH funding at Columbia each year. Again, defining Columbia in the broadest possible sense. If you look at the national rankings, overall, CUIMC ranks 11th in the country. That does not include the Morningside or the Psych Institute funding. If you would add those two, we'd probably be somewhere in the top 5. But that I can't do that comparison because other institutions may have similar relationships with other affiliates that is not counted in their number. So it'd be unfair for me to try to apples to apples comparison. If you just look at medical schools, the Vagelos College of Physicians and Surgeons, which is at apples to apples, we are 9th in the country. And ever since I've been here, we've, fluctuated between 5th and 15th overall, some good years, some bad years, but we're always in the top 20. I don't think we've managed to crack the top 5 since I've been here, but I can't say for sure. I can say for sure we've always been in the top 20. So challenges, and that's a little bit what we want to talk about here today. And obviously the one that is on everybody's mind, the one that gets the most attention are the cancellations. At first we were getting stop work orders, which means the grant is still in effect, but you have to stop work. Then it turned into cancellations. You saw it in the press, $400 million in awards to Columbia that were canceled. I'm working from a publicly available database. I'm using that so I can do a more apples to apples comparison. I'll put these links in the chat. But the latest numbers are that we've had 180 grants totaling $424 million that have been canceled. And I think that's current through May. I will tell you that in Columbia's case, the bulk of that happened in March and April. I don't think there's been a lot of new news recently, but again, according to this database, which I'll share, 424 million. Now, they are on a variety of subjects across the board, some of which you could probably guess, things to do with DEI, things to do with climate research, vaccine research, LGBTQ health. But there are others as well, things that you wouldn't necessarily think would conflict with administration policy. And by the way, that's the term we use. The term that we hear is the grant is canceled because it conflicts is no longer in line with administration policy. Or something like that. So some of the major grants that we've lost, and these are major center grants, grants that are at least in the millions, sometimes can be in the 8 figures, in the tens of millions of dollars over 4 to 5 years. But grants like the Alzheimer's Disease Research Center, the Cancer Center Coordinating Grant, the Maternal Health Research Grant have all been canceled. But in addition to that, there are just, dozens and dozens of individual investigator-initiated research grants, what is known in the lingo, if you will, as the R01 grant. The R01 grant is the basic grant that biomedical researchers get from the NIH, the bread and butter, if you will, of NIH funding, and they have been canceled. Perhaps most importantly, although by no means the least amount of numbers, are the training grants, though it is also known as the T32 grants, because they're the ones who are going to bring along the next generation of scientists, and those have been canceled as well. I'll post another database in the chat that you can look up. Any canceled grant in the country, it's long, it's not particularly user-friendly, but it has all the information that you'll need to see all the grants. Now, Columbia and some other places have been in the news, obviously Harvard, but we are by no means the only ones to be facing this problem. This map I showed you, I included in this slide, shows you where the grants have been canceled. Overall, I just want to take a look, make sure I got these numbers right. I got to look that up, but several hundred grants totaling $9.5 billion across the country have been canceled. And you can see they're, concentrated in certain areas. That 100 plus in the Boston area is primarily Harvard and some of its affiliates. The 100 plus in the New York area is unfortunately primarily us. That other 100 plus is a combination of schools in the Philadelphia, Baltimore, and DC area, Penn, Hopkins, others that you might imagine. But you've read about Northwestern, obviously the LA area, San Francisco area. Other areas have not felt as much pain from this as well. So that's where the grants are. They continue to happen. I think just my impression, can't say this for a fact, the pace may seem to have slowed down a little bit, but they are still happening. And if you look at the database, you'll see a lot of grant cancellations from March and April, but you will see some from May as well. In addition to that, we've seen a slowdown of what we call notice of awards, essentially new awards. Most grants are four-year grants. We come to an end of a grant. The grant is over. The grant is expired. Sometimes they are extended and renewed, but oftentimes they're not. We move on. We need new awards. We need new funding. The pace of that has slowed down tremendously as well. Again, not a Columbia-specific issue that's happening to universities and research institutions across the country. And the other thing is non-competing renewals. Little deep inside baseball here, but most NIH grants, especially the R01, they're four-year grants. But what they really are is a series of 4 one-year grants with a non-competing renewal each year. You get the grant for 4 years, you do the grant for a year, but you have to show the NIH that you're making progress, that you're doing the work, that you're complying, you're being a good citizen, et cetera, et cetera, et cetera. And if you do all that, you apply for a non-competing renewal, and unless there's a red flag, you're going to get the non-competing renewal. We have now seen a slowdown in non-competing renewals. So as people come up to the end of their annual cycle, they don't know if they're going to be renewed for an additional year, and that's adding a lot of uncertainty to our researchers, to our faculty. Obviously, the ones who have renewals in October, going to have to deal with the ones who have renewals in May and June, already dealing with this. So that's what's going on with research now and the specifics of what's happening with NIH. And obviously, because of where I work, what I know, I'm focusing on NIH, but colleagues at Morningside and other institutions could probably tell you similar stories about what's going on at other funding agencies. Yeah.
So Ross, when we read in the paper that Trump has cut 400, or it turns out 424 million, what I gather from what you're saying here is that they don't just tell you that you've lost the lump sum. They actually go into the nitty gritty and tell you which grants have to be canceled.
Oh yes, they are canceled grant by grant. They didn't just say, okay, you used to I'm going to make up numbers here for a second. Used to have 800 million, now you have 400 million, do with it what you like. No, they are going grant by grant and deciding we're going to cancel this grant, we're not canceling that grant. I am not going to get into their rationale because, to be honest with you, I'm not sure I understand it. Some of them, I got to be careful how I say here. Some of them, it's easy to figure out why they do it. They are specifically contrary to new administration policy. Some less obviously so. But yes, it is a grant by grant notification.
Because some of the ones you mentioned, like the Alzheimer's program, that why would they want to cancel that? Or some of the research around cancer and some of the other stuff.
I do not have an answer to that question.
No, we can't speculate.
But I will say this, and I don't want to underplay it. Those are major grants that we've lost. Those are by no means the only Alzheimer's grants that we have on campus. Those are by no means the only cancer center grants. The Cancer Center Coordinating Grant is an important one because we have a designation as from the NIH, very, very rare, and it's a great honor, as a comprehensive cancer center. So that in addition to having individual researchers doing cancer research, we are funded to coordinate all that, to do basic research, to do clinical care, to do community-based participatory research. And that's all coordinated by our cancer center. And we get funding to manage those operations. That grant was canceled. And again, we're not the only one. I know for a fact, as an example, I think University of Utah had their cancer grant canceled. That may have been the CTSA. I forget, but we're not the only comprehensive coordinating grant, CCGG, out there.
But when these grants are canceled, my fear is that all of the work that's been done up to that point could be lost. Am I wrong about that? I mean, can you just pick it up if they decide that they're now amenable to whatever concessions Columbia has made, and they agree to restore the money? Can the researchers just pick it up from where they left off 6 months later down the road?
I think the answer to that is it depends. First of all, I should say that in a cancellation, what I've seen, if there is a human health reason for sort of a wind down, they will allow that at times. So, if you were on a drug regimen, and there can be some small flexibility. A lot of it depends on the specific work, where you are in the process of that work, when and if and when the grant gets reinstated. If we're able to find other sources of funding, if we're able to rescope, narrow the scope. This is a lot of what we as an institution are managing right now. Now, I should let you know that, we have been using university resources to try to mitigate, or at least temporarily mitigate the effects, so that we can keep a lot of this work going in some form or another. I'm not going to claim to you that there's been no effects. Of course, there's been effects. We're doing whatever we can to soften the blow, if you will. That's been a challenge that we've had, working with our research administration, working with our faculty, working with our with our investigators, to try to figure out how can we navigate these, frankly, uncharted and very choppy waters.
So are you in fact like in negotiation with the administration over grant by grant, trying to make
I really don't want.
You can't say.
Steve, I apologize. That's not something I feel comfortable talking about at this point.
All right. Now, you did mention earlier some research around vaccines that's been interrupted. Can you go into detail about what type of vaccines we're talking about there?
No, not specific, other than we have, a lot of people who do vaccine research, especially in pediatrics. Again, they'll be on that database, which I share. If you have any specific questions, I can try to get that. Steve, I will admit I did a little homework in preparation for this talk. I did not do that much homework to go grant by grant, but yeah, certainly there is vaccine research done there.
All right.
That's been canceled.
All right. Well, you may not pass on if you didn't do all your homework. Any other questions?
Okay, can I just mention a couple other things?
Oh yeah, go ahead. Yeah.
Or am I getting the hook?
No. I'm giving you about 8 more minutes.
Okay, so just looking forward, because this is what we're dealing with this year. We still got next year to look at. Now, in March, Congress passed the president signed a continuing resolution. So funding for this year is the same as it was last year. Normally, in my business, we don't like continuing resolutions. We like to see increases in funding. Continuing resolutions are essentially the status quo. There are a couple of changes, but basically, continuing resolution says whatever you did last year, you get to do this year. So in our case, in FY25, a CR was actually sort of a good outcome. Certainly not the worst possible outcome. But last month, President Trump introduced his budget request for FY26. Federal fiscal year 26 begins October 1st, and you can see he is calling for significant cuts to all the major research funding agencies. NIH 41%, CDC 54%, NSF 57%, and read down the line. That is going to be a devastating blow to research in this country. And I don't care if you're a big university, a small university, an engineering school, a medical school. If this goes through, and that's still a big if, it's going to change the face of research, not only at Columbia, but nationwide. The other issue that we're facing is a cap on what we call facilities administration costs. When we get a grant, we get a certain amount of money to actually do the work. We also get a portion of that money goes to manage to run the institution, to pay the utility bills, to pay for the maintenance, to pay for the shared facilities, things that is not necessarily tied to a specific grant. F&A costs or indirect costs is a very complicated formula. I could not begin to explain it to you. All I can say is that Columbia's rate right now, and this is a public number, is 64%. It varies from place to place. We're on the high side, but by no means the highest. The administration had its way. They capped that at 15%. Now, they tried to do that back in February. Several universities and attorneys general sued and have won. So the administration was prevented from capping F&A costs at 15%, although the administration is now appealing. But our current F&A rate is our negotiated rate at 64%, and the other schools as well. But come October 1st, we could see a significant decrease in the F&A costs, which would make it very, very difficult to run a major biomedical research institution or any sort of research institution. And then finally, while all this is going on, it's not specifically related to research, and this is something which may affect our colleagues, which definitely will affect our colleagues at NYP as well. We have budget reconciliation going on, or the One Big Beautiful Bill, which, by the way, I checked, believe it or not, is actually the official title of this bill. If the first line of HR 1 is "This act shall be referred to as the One Big Beautiful Bill," which is just, well, we'll leave it at that. Extends the 2007 Tax Cuts and Jobs Act, reduces revenue by $3.7 trillion and spending by $1.3 trillion over 10 years, so increases the deficit by $2.4 trillion over 10 years. $723 billion cut to Medicaid over 10 years. Threats to what is called the New York Essential Plan that was created by the Affordable Care Act. And one thing it does, which does not affect us as an institution, but affects many people in New York, it does increase the SALT cap. So with that, I'm going to end sharing. Again, I will put those two links in the screen, in the chat when we're done, but I am happy to take any questions. Steve, you did have one question about workforce reduction.
Oh, yes. Yes,
This is
thank you.
public. So back in early May, we unfortunately, after 2 months, had to notify 180 people that their jobs were being eliminated. These were people whose funding was specifically tied to a canceled grant. They were hired specifically to do the work on this grant. We were able to keep them on for another 2 months before we actually had to give notice. And then there's a process that's involved after giving notice. But that's something we had, unfortunately, regrettably, we had to do. We have, thankfully, to some generous donors, been able to create a stabilization fund, which will help, hopefully, some of our investigators sort of navigate these tough times, get us through the choppy waters, if I could overuse the metaphor. That's a small solution. It's not a big, long-term solution. But that's sort of where we are.
Well, wouldn't some of these researchers have faculty appointments at the medical school? Are they not? Are they only at the medical center for the purpose of doing a particular research project? Wouldn't they have maybe other jobs or?
Oh, they do, but staff are specifically hired. A research assistant, a research scientist, a lab manager. Well, a lab manager would have more than one project. That's not a good example. But if you get a grant and you get significant amount of money, you're going to hire people to carry out that. When we do community-based participatory research, we hire people to go out into the community and do surveys. The glass walker,
Right. So the people who got laid off were basically is support staff.
not necessarily, they could be scientists as well, but they were hired to work on a specific, that's the thing here, Steve. That's a distinction. It's not specifically what their job responsibilities is why they were hired, and more importantly, their source of funding.
And most of the ones of the 180, most of those people were up here at the medical center.
That is correct, and that makes sense because most of the biomedical research at Columbia is done up at CYMC. Not exclusively, there were unfortunately some job losses at Morningside as well.
But we had the brunt of it here.
Yes.
All right. Any other questions? All right, Ross, this is obviously going to be a continuing saga.
Yeah.
You may just be compelled to have to come back here again at some point and in September and maybe give us an update. Hopefully this situation maybe resolve itself over the summer, perhaps, or at least improve in some way. Mary Edison has a question.
Hi, Mary. I can't see you, but I'm saying hello.
Not actually a question, just a comment. I live in the neighborhood, and there was all kinds of rumors and questions going around and about. I was in the park and I heard people talking, and so I thank you for this presentation that kind of clears some of the questions up. I can go back to people and give them a little bit of information. So,
Mary, I appreciate that, and that's what I'm trying to do. But I got to be clear here. There are a lot of unknowns, and I hope I have helped people understand, give a better idea. But I hope I have not given the impression that we know everything that's going on, that this is somehow predictable. If I've done that, then I apologize. This is still a very, very fluid situation. I'm just doing, the best I can.
I'm involved in a lot of research programs myself personally, as well as, various things I do in the community. So.
No, I appreciate that, Mary. And, I appreciate you as a community member, as a friend, but also someone who participates in research, and not to get too sort of high-handed here, but we cannot do our research without people participating and working with us on that. So I applaud you for doing that.
Thank you. Hi, Ross. This is Carmen.
Hi, Carmen.
Hi. Good question for you. I'm not sure if you actually mentioned whether or not there were current studies that had active patients or people in the neighborhood participating in them, whether or not they've been cut. And my question to you is, if that is the case, how soon are patients being notified? I'm assuming some of them they give you some notice, or like, what's that communication like with the people participating in the research?
So I can't speak to the specific. We obviously, people who are participants, we are trying to stay as close contact and keep them informed as well. I'd have to look at specific grants. I don't know how many of those grants were clinical trials or something along the lines. I can assure you, we would never do anything which would put any research participant in any sort of danger whatsoever. And we would always work with our partners, our participants, to ensure that they are, they get the best possible care, even if there has to be some sort of interruption or, God forbid, who knows. I just know that we would never leave our patients, our participants out in the lurch.
Okay. All right. Well, thank you, Ross. Would you mind sending me that PowerPoint so that we can refer to it in our minutes?
Sure, no problem.
All right, great. All right, thank you.
I'm going to put those two links in the chat, and then I'm going to wish you guys a good night.
All right, thank you, and you can go back to your Barker Lounger. So appreciate you coming to us tonight and continuing to keep us abreast of what's going on to the extent that you can.
And Steve, I just got to commend you. You said 7:30. I got here at 7:30. You said half an hour. It is now 8:03. So just very good with the gavel.
Well, it is,
Let's keep it going.
yeah.
It's the whole night.
yeah, I'm doing my best to, I'm trying to change my spots. Okay, thank you, Ross.
Thank you, Rob.
All right, we're now turning to the New York State Nurses Association. We have a nurse named Donahue? What, I'm sorry. Oh, fine, okay. One second, do we, would you, it's okay, but is Michaela, Michaela?
2 L.
Two L's? Okay, fine. All right, but we'll take that up with your mother some other time.
Well, my name is Michaela Donahue, and I've been a nurse at New York Presbyterian for 7 years. Up until recently, I had the privilege working in the palliative care unit, caring for vulnerable patients in this community who were nearing the end of their lives. I was shocked and deeply disappointed to hear about NYP's plan to lay off my entire unit, ending one of only 2 palliative care programs in the city of New York that offers this specialized quality care for terminally ill patients. This decision will impact me deeply on a personal level, not only because of my commitment to this work, but because I'm currently in school completing my Doctor of Nursing Practice degree, and if I'm no longer employed, I will no longer get tuition reimbursement. I feel the rug has been pulled out from under me. But mostly I worry about my patients, their families, and my colleagues who will no longer be able to rely on our specialized service. Life, along with perishables, comes with an expiration date. It's something we try not to dwell on or think about, and if we're lucky, we hope it occurs in our sleep, wrinkled and worn, but wise and ready. We push away the idea that death will one day come for us too. It could be a car accident, or maybe a heart attack, or perhaps a long and debilitating terminal illness. As a health professional who has worked many different roles, my most impactful role has been working as a nurse for end-of-life patients and their families. Despite being a nurse for 10 years, working in this setting was the first time I truly got to know and care for my patients as humans instead of just a room number on my assignment. It was small, only 7 beds, but we care for over 700 patients, along with many more family members. It felt like a dream to have this time and space to meet patients where they were as they made their final journey home. I became an expert on shaving unkempt beards and filing nails in between managing fentanyl infusions and suppressing nausea. I held hands and massaged the aching backs who were too weak to leave their beds. We created pamphlets and brochures to educate families on common symptoms and what to expect. We helped to renew vows and arranged for cat and dog visits. I adorned rooms with houseplants, wedding photographs, and crucifixes as I encouraged adult children to let me worry about the caregiving so that they could be sons and daughters. Navigating complex emotions and family dynamics became our specialty. I felt a sense of pride for an institution that allowed for the inception of a place where we could serve a population like this. I asked myself over and over again what the catch was, and now I know. Columbia is putting its profits over its patients, especially its most vulnerable ones. They plan on decentralizing palliative care and creating beds throughout the hospital with nurses and doctors who are not fully aware on how to care for this patient population. We would never mix a woman in labor with a patient recovering from a severe injury, as each requires a distinct level of medical expertise and environment. End-of-life care is no different. It demands its own space, structure, and specialized medical attention. In practicality, even accommodating a single visitor per patient at a patient's bedside is often challenging. How will this work when a family needs to be present during a loved one's final moments? More critically, how does this setting acknowledge the significance of death itself? The moment requires space, silence, and an environment capable of holding this immense grief of those left behind, something that simply cannot be achieved in an ICU or an emergency. Hospice makes pennies compared to the robust surgery service. Inpatient hospice care is referred to as general inpatient care, or GIP, and it is reimbursed at a rate of $1,145 a day under Medicare. Pennies compared with prolonged ICU stays that will run you upwards of $10,000 a day. It is unconscionable that New York Presbyterian, one of the wealthiest and one of the most financially stable healthcare institutions in New York City, is shutting down my entire community. NYP already struggles to hire and retain enough nurses for state staffing. NYSMA is trying to ensure that displaced nurses can fill open positions throughout the hospital system, but there's no guarantee. We know the hospital can afford to keep its nurses and its healthcare workers. Again, it is the wealthiest hospital in New York City. In fact, over 30 healthcare executives at NYP make well over $1 million a year in salary, benefits, and perks, including CEO Steve Corwin, who makes approximately $14.6 million a year. If they actually needed to cut costs, they'd look into executive salaries instead of the nurses who care for our people. We're here because we need your support in pressuring NYP. We demand evidence that the hospital needs to make sweeping job cuts. We demand access to financial reports and projections that the hospital is using to justify cutting jobs and care. With extreme cuts to Medicaid looming, this is a time when New York's nonprofit healthcare providers should be protecting quality care and patients. We are demanding NYP participation over profits. We demand financial transparency, a reversal of cuts that impact patient care, and guaranteed placement of nurses in open positions. Please stand with us. Please speak out for our patients and the future of healthcare in New York.
There isn't much more to be said there. But of course, I'm going to ask some more questions. So the entire palliative care unit is being dismantled?
Completely, yes.
So how many staff are we talking about?
So it's nurses. There was 2 clerks and 4 nursing.
What?
Nursing assistants.
And yeah, did you say there were 7 beds? But you also said that you took care of 700 patients?
So since the unit's inception in August of 2023, yeah, we've had over 700 patients come through the unit.
In less than 2 years?
Yes.
Okay. I never knew that there was a palliative care unit, so it's only 2 years old.
Yeah. There was another palliative care hospital in Montefiore that was also shut down, and the only inpatient hospice center in New York City for patients who need that type of care is in Mount Sinai is the only one. The only place that you can get that specialized inpatient hospice care with a dedicated unit with professionals who know how to care.
So they must have made a determination just 2 years ago that this unit was necessary.
Yeah. More than necessary. We take patients out of the ICU, out of the emergency room, out of multiple units throughout the hospital, and I think it will only disrupt flow by not having these services.
Right.
Happen. Those 2 happen. Well, like, let's have this unit to, oh, we don't need you guys anymore.
That was what.
What we're trying to figure out, that's what we're debating.
Yeah.
And the need is still there, because they are continuing with the patients in the hospital.
Could you just state your name so we have you?
My name is Jaipeer. Last name Grewal. And the need is still there. The hospital recognizes the need because they're still having those patients dispersed throughout the hospital. They're just getting rid of the unit as a decentralized area, decentralizing it basically. So the nurses who are, I'm a step-down nurse, for instance, right? Medicine step-down nurse. They can be on my unit now, and I'm not as specialized in end of life. That's the issue. That's why the community is so impacted with this decision.
Okay, but what we're talking about is not just 7, but not just 10 nurses. We're talking about 42?
Total is 40.
40?
Total is about 40.
And then,
have more speaker and say.
oh, very good. And 1 second. And would that be a nurse practitioner named Karen Eck?
Hi.
Go ahead.
If you can just come a little closer so that we
Yeah.
can hear you up on the mic, maybe
Okay.
I'll sit right here.
Okay, ECK is ECK.
I'm here, not working at this moment. I finished my shift earlier today. My name is Karen Ack. I don't have maybe as detailed as a speech as Michaela's, but I'm a nurse practitioner. I have been employed at New York Presbyterian for over 35 years. Over 22 of those years I've spent in pediatric epilepsy center, caring for children with devastating neurological conditions and medically refractory seizures. I'm speaking out because, again, the hospital is choosing to eliminate patient-facing providers, right? This is a word that you heard during COVID, like patient-facing, right? We were the most at risk, right? And now we're being cut. They're cutting us instead of the multiple layers of management. And I know we're in tough times, right? There's cuts, but it doesn't make sense to cut the people that are caring for the patients directly. So the impact of this is I work inpatient and outpatient, but predominantly inpatient in the epilepsy monitoring unit. This is a unit that's centralized on the 6th floor of the Morgan Stanley Children's Hospital, or now Children's Hospital.
It's no longer Morgan Stanley?
No, I don't know.
Oh.
That's what.
Okay.
These patients have multi-system illnesses. It's not just epilepsy. Sometimes it is, but they're multifaceted care. These children can come in for one night, sometimes 2 weeks, for EEG monitoring in an effort to understand their epilepsy better. In many cases, we will lower medication in an effort to capture their seizures and find better ways to treat their seizures. These are children that aren't responding to 1, 2, 3, 4, sometimes 6 medications. So these are very, very sick children. Right now, the cuts to myself and the other nurse practitioners and the predominant caregivers in this unit, essentially are closing the unit the way it functions as we know it. We will not be able to do these medication weans. The hospital's answer to this is to send the patients to Westchester. That was a Lawrence Hospital. However, this is a community hospital. They have exactly 6 pediatric beds, 6 for any pediatric patient. And they cannot do med weans. They don't even have a PICU. So any of our patients with behavioral issues or any of our patients that have more complex medical needs, tracheostomy, they require respiratory support, tube feedings, they can't go there. Additionally, this is Westchester. So many of our patients from the community cannot afford to go there. It's a $20 train ride each way. Often our families will come with one family member. Yesterday, actually Monday, I admitted a patient who came with her older brother, 24 years old, who was her CDPAP provider, while mom drives the school bus. 6 o'clock at night, mom came and stayed with the child overnight. The next day, mom left, brother was there. So that's would be 4 round trips with a $20 train ride to go to Lawrence Hospital. Additionally, this child had significant behavioral issues, of which Lawrence, Westchester, NYP Westchester cannot manage. So we are not meeting the care of these children. There are most vulnerable children. The Children's Hospital really cares for some of the sickest children in the city. And I don't know what that future lies. I feel that we're pulling out of this community and moving towards these satellites in hot, areas where people have private insurance and more money. And this is not going to meet the needs of our community. So at the end of the day, yes, I am losing my job, but I will transition to likely an RN role and take a pay cut. But I am here because
Somewhere else within the medical center.
within.
Well, yeah,
I will come.
yeah.
I will see you.
Yeah. So that would be you're a nurse practitioner.
Yes, I am.
So
for
that-
over 22 years.
So that would be a demotion, no?
Do what you have to do, right?
Yeah,
Step time.
yeah.
Step time.
And let me say, when we talk about 40 nurses, the nurse practitioners are on top of that? They're,
They're included in,
they're part of the 40?
So. Right, so there's myself, there were 3 of our specialty nurse practitioners on our floor. One was cardiology, pediatric cardiology. And myself and another pair, nurse practitioner in pediatric epilepsy. And then the 8th floor, which is a step down unit. All of those nurse practitioners were, without really a clear plan.
So I'm sorry, are these the only nurse practitioners within the children's hospital?
No.
Oh,
there's other
okay,
nurse
there was,
practitioners.
okay,
I mean, I fear for
okay,
next.
Yeah.
like,
yeah.
So,
And have you been told when these layoffs will take effect?
oh, my last day is June 20th, and I still don't have I don't have an offer for a final job. And I'm there for over 35. Care.
And-
This
and-
neighborhood is
well,
my second home.
yeah.
I love these patients. Sorry, I'm emotional, but. And some of my patients had cured for since, and I graduated them to adults. And it is because of that coordinated care with consistency, not a random resident changing every week. It's that coordinated care is why those children are surviving and why their parents have them to love them. And it is heartbreaking to me. Yes, I'm upset about my job, but I am heartbroken over what this is going to do to our epilepsy center and the care that we provide this community. It is very, very sad. We won't be able to do epilepsy surgery because we won't be able to do the workup. It's very short-sighted. And yet you still have multiple layers of million-dollar, multi-million-dollar administrators. And I'm sorry, I know that times are tough and we might have big Medicaid cuts, but we have to find better ways than to penalize the patients. You know, I go home, right? I come to work. I'll go on. I'm not so sure about some of my families. I really am. I'm not. So that's all I have.
Well, can I call you Karen? I mean, your devotion is, is just obvious, and the amount of care that you give to your patients and concern that you have for them is extremely impressive. And I wish we had the power to just countermand what's going on and tell you that you could stay there. But and we, I think we're going to do whatever we can. But
I just
we're we've already had a series of issues with the hospital. This is somewhat reminiscent of what's going on with the rehab unit, where they think that people can just be farmed out to Westchester and elsewhere instead of being given care right here in our community. Yeah, the midwives, and and the issue we still have with the psych beds at the Island, which we were told we're going to be restored. Finally, 24 of the 30 beds were to be restored by now. Still hasn't been done. So this is part of a pattern, I guess, and it's really a shame. It's really.
I find it very disheartening that we are doing a complete about face from what we were doing 2 years ago. Trying to embrace our marginalized families and make sure that they got what they needed and make sure that their voice was heard. And I feel like we are coming from that. Only a few mere months, and it's easy to blame it on the federal administration. But I just wonder, is it just an excuse?
Well, what I'm afraid of is what I'm afraid of is what's next when this big beautiful bill gets passed in Washington and the Medicaid and Medicare cuts come down the pike. What other cuts are going to be happening here? I mean, this.
They can definitely postpone the $1.4 billion building do it in stages and not fire the nurses. There is a way. I just said that. Here is one.
Oh.
What?
Well,
what-
Michaelia, when is the date that's been given for the, also for you? So that's true then for all of the nurses, all 40?
I have no idea what time that they're currently full with. I don't know if they expect them to pass away sooner. I don't know what the plan is there. There is no plan.
It also doesn't include the class two way. number.
Yeah, do you have those numbers?
I still
Because to be fair, I'd like to deal with the entire issue, not just your members. It affects the entire, you think we would have it within the next week or?
Can we?
Julio, do you want to speak on this at this point? You seem to have a statement or something?
I do not, Steve. I'm taking it down. Taking the information and I'll, be taking it back to our folks. What's being discussed here. I did send you something on it in terms of, the pressures that are that we're feeling as well as university. But as I said, I'll take this information back and share with folks at the hospital.
All right. So for those who don't know, Julio is do you have a new title or are you still community affairs liaison?
We're sort of in transition. Where, as you know, we also lost some folks in our department. So we're still in transition. I'm not sure what the title will be.
All right. So as far as we know, you're the community affairs liaison for the hospital.
For the time being, I will continue to serve that role for the time being. Yes.
Okay. All right. Very good. All right. So, Jacob, do you want to share the draft of your resolution?
Yeah. Do you want me to read it as it exists and we can go through and add detail as necessary, or
Just put it up on the screen.
Yeah.
Okay.
I think we're going to be doing. I mean, it's a very good work in progress, but Michaelia and Karen have raised some additional issues, which I would like to incorporate into the resolution, and there are there are points that NISNR has raised about the profitability of the institution and those $1 million salaries that I think we should make reference to. This is really based on the information we had as of the board meeting a couple of weeks back, where I think we had someone else speak at the from NISNR at that board meeting, right?
Yes.
And she was also a nurse practitioner, right?
Yes, Diana.
Right.
Yes, her name is
Right.
mentioned.
Oh, okay.
So I agree with Steve's overall point about adding more information based off the discussion today. I also think because you referenced the settlement, I think Opie's point about the expensive building, that's another thing I think that kind of bolsters the argument that you're making, which is basically there's a lot of money to be spread around for other things that are also really important. So I would consider adding that information, also the year.
But I wonder. I'm under the. I don't know if we can attribute this to the settlement in that Robert Haddon case. But wasn't that covered by their insurance?
No, there's the cap.
I think yes, but not all.
Yeah, I'm totally open to reworking how we want to frame this.
Yeah. But we are pretty secure in the idea that some of this is a result of that settlement?
I mean, it came on the same day. It's hard to
Yeah.
say.
Yeah.
So it is, yeah. They've never admitted that.
Not even-
Yeah, right, yeah, yeah, right. Yeah,
I think maybe, I forget exactly how you framed it, but I think just saying like, because of the corporation's lack of transparency, it lends itself to this assumption that there is a
connection there.
connection between.
Yes,
things.
yeah, that's a good way to phrase it, yeah.
I don't know where we want to work that in. but-
Well, we'll figure it out.
Okay.
We'll figure it out. Yeah,
Because their ask is about, having access to the information. So,
Right, which is, I think would help with this.
yeah.
and I do want to make the point, which I think, oh God, either Michaelia or Karen brought up, and the fact is, these are maybe it was Karen. These are frontline workers who will work through COVID, and this is the respect that we're now showing them. I mean,
Well, they
it's,
do
yeah. Well, we care.
Well, right, we're gonna put that in the resolution that
Yeah.
they don't care.
Well, but we're going to make the point that we care. That you have to at least show some people respect for what they've just done over the last few years. And this doesn't portend well for what's going to come down the pike when the federal budget gets passed with all of Trump's new cuts.
They're gonna cut more nurses.
Yeah, well, they're going to cut the bone.
And they call themselves the #1 hospital in the US.
Yeah.
Joke. Sorry to say that. That's a joke.
Ottawa is the-
Yeah.
That's very-
Right.
And that's, I feel like these.
I should really think that we should give an example, like they should lead by example, and those executive, I don't know how many of them, right? Should get a pay cut in order to sponsor those units. Why not?
I'm okay with that. I would call upon them to voluntarily show their commitment to the institution by giving up some of their salary in order to keep the institution going in full strength.
I'm sorry.
But we're-
And I can't type the minutes and do the resolution
No,
at the same time.
No, we'll figure it out. I mean, the key thing at this point is to say that in the last two resolves, Committee Board 12 recognizes the critical role provided by nurses as frontline employees during the height of the COVID-19 pandemic. Oh, it's already here.
Yes.
And be it further resolved, Committee Board 12 respectfully requests reversal of the elimination of the nursing positions at Columbia University Irving Medical Center, including, is this accurate? Including the Milstein Hospital, the Allen Hospital, and the Children's Hospital. I assume all three facilities were affected? Really? Oh, okay.
It was already impacted once they took the psych beds, right?
Yeah.
Don't add another insult to this.
Okay, fine. So, but it is both Milstein and Choney. But I really, Nicholas, I really want the numbers of the from the other unions, because it's not going to look right if we're just talking about the nurses. With all due respect.
And we also have to say that, between the psych beds and gradually, there are more and more nurses that are being eliminated, or units, I should say. And this is going on for the last 2-3 years-ish. It's becoming a trend.
Yeah, I know, I said that, yeah.
Right, no, but my point is just, I think we should mention that the elimination of nurses is going on for the last 3 or so years. Somewhere on that resolution.
Okay, or is that an accurate statement to make? Nick, is it accurate to say that we've been losing nurses consistently over the last few years?
I want to be really clear, the Allen, they have lost me. After that, the event practice of midlife. And I believe that was for a total of very massive, right? 8. So now we're talking about, I believe, 15 MPs. I'm sorry, 16 MPs. So there is a trend and the MPs that they're, but the MPs, there does seem to be a trend the last few years.
I'm sorry, I'm sorry, yeah. So, but did you just say that you're losing 16 NPs now? So of the 40, 16 are NPs.
The other thing to remember is that, they are going to services that are more profitable to them.
Right.
They are expanding, I see, making the new building, so it's not like they're not expanding, they're still expanding, but this is the community issue with the end of life care. This is the issue with the nurse practitioners, we're talking about.
It's
All right.
property, they have to make the money for the square footage.
Yeah. All right, so let's, do I hear a motion?
Do we want to through this first or?
Yeah, Carmen, Jay,
I'm not adding a whole paragraph.
Live at it.
We're gonna trust that we're gonna end up with a resolution that's
Yeah, I'm adding some of the more specific details, like the patients.
Okay.
700 patients and everything.
I feel like one thing that is sort of implied, but that I don't know that they've said explicitly is like,
Guys, we can't have two conversations, sorry. Thank you.
because, for example, there will only be, for example, one remaining palliative care unit, to the extent like she would want to find a job, it wouldn't be within the same care context. Like she would have to find a job.
well, but apparently that's but that appears to be the case with most of them. They're gonna have to they're gonna switch. If they take other jobs within the medical center, it's going to be in different units and doing different types of work. They'll remain as nurses, but as Karen said, she'll be doing a completely different type of work.
But even if they like, Mount Sinai is probably not hiring 10 more. You know what I mean? Like,
Yeah.
It's basically like a unique situation where they will not be able to functionally do the same role within the same care context in any other.
Has the medical center
Yeah.
has the medical center said that they can guarantee that you will have other jobs within this institution?
Vacancies, but they're not necessarily jobs that, this is my career, over 22 years. So have to do what you have to do. And I feel like it's very excited because the inability to evaluate patients for alternative treatments for epilepsy is a huge loss for this monetary loss as well. Like, no doubt in my mind, they will lose money on this. Like, we do make money. If the patients for AG monitoring, it's not nothing. And if they end up having surgery, they make money on that. So they won't be able to do it at Westchester. They'll have to try to do it at Cornell, but that's our physicians won't send, like Cornell is separate,
Sure.
So it's very short-sighted. It's unfortunate. And the patients are the ones that are gonna suffer.
Okay. Are you calling? You can have something to show us, or should we just vote?
Yeah, I added, I don't even know where it is. Jacob will have to fill it up.
Huh.
So I don't know where I can't.
1 second. Sorry. Lots going on.
What else?
Okay, what were you saying, Carmen?
I'm trying to go to what we just added. Steve asked. Yeah, I think it was that paragraph. Added some details about the amount of patients that they added in that whereas, so you can see right at the top.
Yeah.
More details about the team, what they provide, critical end-of-life care, towards the bottom, I inserted.
But we have to make it clear that this is just one example. This is not the whole universe. We're talking about, because these are 10 out of 40 nurses. So this is just one example of what the impact is going to be.
We'll edit that.
Yeah, we'll edit it. Yeah.
And then towards the bottom, we can scroll down. I added a completely new whereas, healthcare professionals and advocates have raised concerns about the lack of transparency around these layoffs and closures that have called for likely going to release cash reports and projections underpinning these decisions. Or something like that.
Yeah.
If you want to say something about it.
Yeah. That's good.
Yeah.
But I want to do our own little research to confirm how much profit the medical center or New York Presbyterian in particular has been making. Want to cite that because
How many officers are?
yeah, right, are making
$1 million
or more, right?
salary?
Yeah,
I think we should,
well, we can include that.
Yeah.
I think we should emphasize somewhere in a new whereas, that the closure of one of these units only 2 years after the creation would leave New York City with only one unit in the entire New York City. I can just start typing it.
Yeah, well, that could go in the same whereas. And,
Where you describe the
yeah.
unit.
well, you're saying it's one of only 2 such units. Yeah, okay, we can,
I'm gonna put it separately. Right?
but is that, Michaelia, is that accurate? Is it one of only 2 such units?
But yeah, the only one left.
It will be the only one remaining. Yeah.
Okay, okay.
Yeah.
Oh, yeah, we have to make it clear that, that this is happening on June 20th. We're not gonna be voting until,
We're
Until-
actually conducting the executive.
Yeah.
yeah, we'll have to take it to the executive committee.
So what does that mean for patients that if there is only one unit left, in which hospital you said? In Mount Sinai? Okay, what does that mean in terms of the, waiting to get services, right?
The hospital is under the impression that they can sit anywhere in the hospital, on any unit, by any nurse. But the problem is a lot of nurses are not confident, or not even, not the word confident, but they're not familiar with the medication. There's a lot of family education. There's, that they cannot manage on top of their other patients.
Okay, yeah. No, I mean, it's gotta take a special type of person really to work in that kind of a unit. I mean,
Yeah.
no, yeah, yeah, absolutely, yeah.
But it's hard to ask another nurse who has a full assignment of patients who
Yeah.
need to
Right.
transfer to the ICU, need other things to hold the same space for a patient.
Right.
I also want to give what Jay had said earlier, which is when we zoom out and we
Well-
see that they are
Oh, shoot.
essentially cutting 40 of the position, the hospital is also expanding. And we have to see where they're expanding to. They're expanding to the ambulatory center in White Plains. They are expanding, they tore down the Eye Institute, and now they're going to create that. The hospital does not seem to have a money problem in certain ways, and they're gonna expand. And so I think that wherever we can craft that, is this a money issue?
Right.
Or is this how we're
Well-
cutting services to the community?
Well, this is the point that OC made earlier that, yeah, right. All right, well, listen, we still have a bunch of things on the agenda. So why don't we just vote on what we have? And we're gonna, I mean, we have more of a resolution right now than we have, on many other occasions.
We understand the content.
Yes.
Yeah.
Mhm. Yeah, we know where it's going.
Great job, Jacob.
Thank you.
Heidi's making a motion?
So vote on?
Yes, yeah.
Yeah.
Okay. And is there a second?
Second.
Okay, Jacob seconds. All right, All those in favor of the resolution, please indicate by raising your hands. 1, 2, 3, 6. I didn't call you yet. Are there any other committee members voting? No. Any other committee? Okay. Are there any other members of the community board present who would like to vote? Oh, is that you? Okay.
Oh, yes.
Yeah, and you vote yes. Okay, so that's 1-1-0-0 on other board members. Are there members of the public who would like to vote on this resolution? You're entitled to vote. You can indicate by raising your hands if you vote in support. So that would be 3, 4, 5, 8. Is there anyone no one is voting no, no one is abstaining. All right, the motion is carried, and we will have to try to bring it before our executive committee, which meets next week.
No.
No?
Following.
The following week. Okay, but I hope it may just barely be before the 20th. All right.
I have to ask Catherine to push it through.
Yeah.
Also include about the pediatric units that are also being affected.
Yes, and I recorded what you shared with us in our minutes, so we use that to figure out the rest of the resolution. I did the best that I could to draft it after a general meeting, and we're putting as much information in it as we can as we go along. And just, for the whole context too, it's like the next general meeting of the community board is the 24th. And so we're planning to bring this to our executive committee, who has the power to push it through before then and before the 20th. And we're doing all of this on the fly because this is very urgent. And we want to make sure that just because we're not meeting, it's not like left behind and forgotten about over the summer. This is critical work. So
What is Tamska?
There's the calendar up front.
The executive committee meets on the 16th.
Ah, okay. They can be present if they want to, they just can't talk.
I'm sorry.
It's just. And what else? So the expenses are.
All right, so
Okay, so basically you can just say
Yeah.
that they have a surplus.
all right, so Nick, you'll get back. We're gonna try to bring this to the executive committee, which meets on the 16th. So but please get back to me as soon as you can with the additional information for us to include. All right, very good. All right, take care. All right, thank you all for coming. All right, we're gonna move the agenda. I'm so boy, who's left?
Pauline.
Oh God, Pauline, are you still with us? We probably
Hi,
lost-
good evening, everyone.
Oh
Yes,
my
I'm
God,
still
she's
here.
with us.
Questions there.
You know what? She just surprises me every month. But Pauline, thank you so much for hanging in with us.
Sure.
But you can't speak yet. Hold on.
Okay. I'll mute myself.
Yeah.
General, question.
General.
Yes, I'm not, no, maybe about this, about your stats, and not trying to be offensive at all. Until when will we continue reporting these COVID rates?
Oh,
Is that indefinite?
well, until they go down to zero.
I'm not saying that it's an issue, but.
I mean, it's a good question, and I actually, I don't know that we'll ever get to a point that they are back down to zero, to be real.
Right, because.
Four
now-
summers now where we get waves of COVID, and
Yeah.
not, that's not critical.
Right, that's what I'm
but-
saying, but it's like now it's becoming like a regular, people don't even do anything if they have COVID. People at work now, they're just like, oh yeah, I just had COVID, but I'm working remote or
Oh,
they
I-
still
well-
go outside, so just
Well,
curious.
Well, to me, it's still an issue, and it's and then the fact that people in Washington are like cutting back on the vaccines. I think to me, it's incumbent upon somebody to still, put some attention on the fact that people are still getting sick. People are still dying. We had 7 people in our community die since the last time we had one of our committee meetings. 396 more people got sick.
Is that comparable to the flu?
I don't know, we could ask
Because
Pauline.
people, like people always die from the flu, for example.
Yeah.
I also ask, now that I start asking about rabies. So even
Yeah.
though, I mean,
Right.
like, because I'm trying to.
And to me, it's also significant that zip code 34 is ranked in this last reporting period as number 2 in the city in terms of its hospitalization rate. I've never seen I've never seen any of our zip codes that high on the list. No, I don't think so.
Wasn't expecting that.
So 18.9 people out of 100,000 were hospitalized, and so they ranked number 2 in the last 28-day reporting period. No, so and so as I mentioned, since we last met on April the 3rd, 396 more people in our 4 zip codes got sick, and 7 more died. So I sort of I got a problem when people say that you don't have to pay attention to it anymore, or that the pandemic is over. People are still suffering from it. But Pauline, what do you think on that issue?
Hi, everyone. Yeah, I mean, I still believe, let me share my screen so everyone can see. I pulled up a whole bunch of stuff, but here's the COVID data. And I know that a lot of people are very interested in the new variants. And so I just want to share that we do have information on the various variants that we do test for. And so we haven't seen that new strain that they're talking about in the news that came out of China, but this one, the LP8.1, that was the most recent one that caused a lot of, that we saw a lot of cases being diagnosed with that particular strain. And so, it's just interesting data that we have on our website for people to look at. And then all the information that Steve was talking about can be found again on our data page and by neighborhood. And you can see that indeed Inwood, Washington Heights, the 0034 zip code is ranked number 2 currently over the last 28 days. So,
what was that 28-day period? What does it say there? April
19th to May 19th, I think.
Is that right? Is it April 19th?
Yeah, April 19th to May 16th.
Okay. Okay.
So, we just wanted to make sure people continue to take precautions, even if it's not COVID, it could be, so I could pull up, do I have our flu influenza data? I apologize, I didn't pull it up.
And do we know whether the current vaccines available are they effective against this particular variant?
So I'm not sure about that because this is a very new variant that we have not yet seen yet in the city, but I don't know sort of how that type of surveillance leads to the different vaccine development. So I can definitely ask our vaccine team if they know sort of how that process works. But I do know that in terms of the flu vaccine, they sort of take information from other areas where they experience flu season earlier, and then they can sort of anticipate what strains are out there and develop a flu vaccine for that season, depending on what they're seeing. So I'm assuming that the COVID vaccine is similar in that regard. But I don't know for sure. And then also there's all this conversation about who's eligible now for the vaccine. So that's all very confusing as well. But I will keep everyone updated about that. But currently it looks as though if you are not if you're not 65 years or older, or if you don't have any underlying health conditions, you're considered quote unquote a healthy individual, you might have to pay out of pocket for the COVID vaccine. But, that's obviously, I'm not sure if that's like fully cemented, if anyone's tried to go get their vaccine recently and was turned away. But that's something that has been circulating around the news as well. Due to the new administration. So I just wanted to pull up the flu surveillance information.
Does the city health department still advise that people get COVID shots on an annual basis?
Yeah, it's still on our website to get your vaccine. So I don't know when that information will be updated according to the federal government's new requirements, or suggested requirements. And I don't know how that's going to impact, our vaccine clinics and where, H&H can offer COVID vaccines, or the local pharmacies and their offering of vaccines, and if that's going to change at all. So a lot of things are still very up in the air and unsure at this point. But as soon as I get any concrete information in particular about the COVID vaccine, I will definitely let everyone know. But currently still on our website, we are encouraging people to get vaccinated. Obviously, stay home if you're not feeling well, and continue to wear a mask when you are in crowded public places like the subway. So we do have influenza surveillance, of course, as everyone knows. And it'll end the end of May. So we have the most recent one for week ending May 17th. And as you can see, all the numbers are going down, which is good. Again, this is readily available on our website if you want to delve deeper into sort of what the subtype is and what we're seeing in terms of other respiratory illnesses in the city. And so I do encourage everyone to take a look at that when you have spare time, but we are seeing very low numbers for that. So that's encouraging as well, but also it is the end of the season. So
but to answer I think Heidi's question, how have people been dying from flu?
I don't know if we have that information in terms of deaths, but I will look into that and see if we have any information.
Yeah,
right now, all of it is just data in terms of collecting of specimens and what, type of influenza they were and how many people went into the hospital for influenza-like illness. So we don't have, there were no pediatric deaths. So I think maybe we do only, here, and total of 12 influenza-associated pediatric deaths have been reported this season. So I think maybe we're only collecting pediatric deaths. But let me just touch base with our data team to double check that information. And then also, I know everyone is very concerned. Oh, I found this handy dandy monthly report that we send out to providers, healthcare providers, but it's available on our website. And it's about current infectious diseases that we should be aware of. So as you can see, as of right now, nothing to report in New York City, but across the United States, there's obviously bird flu, measles, dengue, mpox. In Canada, there's measles as well. And so it just gives sort of a snapshot of what's happening globally. And so we are encouraging everyone, if you're traveling this summer, to please make sure you are up to date on what is happening in terms of vaccinations that are required for those countries that you're visiting, but also just being up to date with your own vaccines, in particular when it comes to measles, because we are seeing that a majority of people who contract measles have not been vaccinated. So as of May 30th, there have been 6 measles cases in New York City. We have, data from previous years as well. And then we have this information on how it spreads. And so we're encouraging everyone to please get vaccinated and also just be mindful of the areas that you're traveling to this summer. And then for OC, the rabies map that we always put out, this one is, I'm sorry, it's week ending, or it was last updated in April 23rd, and there is nothing happening in Manhattan, which is great. We are seeing a lot of raccoon activity, though, in the other boroughs, which is not great, but we are keeping an eye on that. And then, of course, Manhattan and the Bronx seem to be okay for now.
We have raccoons in Manhattan, but I guess they're not rabid.
Yeah, I guess not. They're well-behaved raccoons.
Unless they die and nobody know that they had rabies, it's not, that's always the possibility. I don't know what the percentage of those cases in general, but yeah. but so far it's good.
And then something new to think about for the summer, of course, is mosquitoes. And so we have mosquito data on our website. And then we just, we talk about the events that we have. So I would highly encourage everyone to go on to our health topics and then just find mosquitoes. And then you can see updates there where we alert the community about upcoming mosquito treatments and what we do about West Nile and how we have it under mosquito control. And then they'll tell you what the scheduled events are. So we did actually do some events already in the Bronx, Brooklyn, Queens, and Staten Island. So the other boroughs where they have large swampy areas, we did like an aerial larviciding, which we pretty much do every beginning of the season to make sure those swampy areas are treated with larvicide so that mosquitoes don't develop. But of course, this is always the best place to go just to make sure if there's any on the ground spray event for adult fully grown mosquitoes, that this is where you would find that information for the community board. But of course, I always email the community board and the local elected officials as soon as we know there's a scheduled event in your particular neighborhood. So those are all of my updates. I have some homework to get back to you guys on. Well, I won't see you over the summer, but I can always email you all and get the information to you just about flu deaths and the COVID vaccine updates.
Yeah, that would be appreciated. OC has a question.
Yeah, do we have an update about the rooster?
So I was told that our team contacted the precinct and they were supposed to go and remove the rooster. And I don't know, I apologize. I don't have an update as to whether or not the precinct did go ahead and do that.
My understanding from the individual who asked me about it and reported that as of 2 days ago, there was the rooster was still there.
Ugh, that poor thing. Okay, I will circle back with our team and then I will get in contact with the precinct myself to see if they can go and remove it.
What's the address? 40 Orange?
Do we need to do the address here in public?
No, I have the address.
What?
It's on our.
Oh, do you guys need it for your notes? But I have the address in my email.
Okay, yeah, 52.
It's been shared.
No, it's not 52.
It's on
Arden Street.
Yeah.
And it's
Okay.
Yeah, it's on Arden Street.
Okay. Just listen for the rooster.
Yeah, it's no fun.
So I will follow up with the precinct and then I will circle back with you, OC.
Okay, thank you.
You're welcome.
All right. Any other questions for Pauline?
Thank you, Pauline.
All right.
I wonder if we could share this in our newsletter, like just a link to the website one of these days.
Yeah.
Or people, maybe I can send it over to Noemi and Paola to share. Like, this is just helpful for anyone. So
Yes.
just log on and see what's going on and get a better idea.
Absolutely, yes.
Useful links there.
Yeah.
Pauline, do you guys have on your website some sort of like quick tutorial on like what you can navigate? Like, is there a link to that?
I don't know.
Here's what you can find on our website, or like a one-pager.
Yeah, they have so much stuff on that website.
I know our website does contain a lot of information and it's not necessarily the most user-friendly. We are working on that. But I don't know if we have a one-pager on sort of what you can find there. It really is just you taking some time out of your day. Like today, I found that infectious disease report, which I think is very helpful. But just, taking some time out and like just poking around the website and finding new information that is helpful to you. But I think the most relevant parts of the website, let me share our screen again.
Well, something for consideration maybe for your community team, something they may want to create in the future, like a one.
Yeah, no, that's a great idea. But I think the community health profiles and also just the EPI query, I think those are really helpful in terms of data collection and reports. So I will definitely take this back because I think that's super important for people to be able to navigate our website in a more user-friendly way.
Isn't the community health profile due to be updated?
It should be updated, I believe, in the next year or two. I don't know what the status is on that, but I will certainly find out.
All righty. I thought it was maybe every 3 years or so.
Yeah, but I think COVID sort of put a
Yeah.
damper on that because, yeah, just I think there was data gathering was sort of, I think, an issue because everyone was just trying to figure out what to do with this new pandemic situation.
Okay.
But I will definitely find out.
All right, very good. All right, because we do rely upon it. It does have a lot of good, useful information.
Absolutely.
Thank you, Pauline.
Okay, thank you.
No problem. Have a good night, everybody.
Okay, thank you. Okay, Julio, you stuck around. You have a report for us?
Yeah, stuck around. Just a couple of things. One is, let me continue just with the COVID numbers, since, still interested. So we had a total of 53 COVID cases throughout our hospitals. One of those was at the Allen Hospital. We had 10 at the Milstein and 2 at the Morgan Stanley Morgan's Children's Hospital, which for a total of 13 for Northern Manhattan.
And what period of time is this?
So this is the latest. I'm not sure. This was the information I got this morning. I asked for the data, so I'll get back to you in terms of the period. But this is as of this morning.
Okay.
And I believe it's really sort of like a week period, 1 week period. But I'll find out exactly from what period to what period. But as of today, as of this morning, these were the numbers at our hospitals up here.
All right. So as of today, presumably there were we had 13 patients in the Washington Heights Inwood facilities.
Correct. Absolutely. Yep. Yeah. So I also want to sort of come back to the psychiatric unit at the Allen Hospital, which is, of course, something that's important to all of you because you've kept this sort of issues alive for the last 6 years. There is, the construction was done. DOH went. There were a couple of things that were needed to be done. They were done. Before that unit opens, the Department of Health, the State Department of Health, has to approve the reopening, and that's what we're waiting for. But the work was completed. We're just waiting for the state to give us the okay to open that unit. So, and I can assure you the staff is anxious to get that unit open.
Julia, do you have an estimate of how long that process usually takes? That process from state DOH?
Yeah, we were hoping that by the end of last month, which is May, we would have gotten that approval. Right now is pending, and I mentioned to Steve that I will continue to ask when the next inspection will take place, and hopefully that will allow us to open the unit.
So as of right now, you guys don't even have an inspection date for anything?
I didn't get a date of when they're gonna come back, but I'll keep continuing to ask and make sure that we're on top of it.
Thank you.
Yeah, the other thing I just want to thank is really Mary Anderson and the aging committee, along with the district attorney's office. We were happy to join with them this morning at the senior fair. I know Carmen was there as well, and appreciate you came by. It was very successful. I think the very morning we must have had over or at least 200 seniors. So we were pleased to be able to join with that and be able to be a part of that event. So I know that there's.
And congratulations to Mary on a successful event.
Yeah, that was really, very, very, very.
Yeah. So in terms of the discussion, I as I mentioned to you, Steve, I'm taking the information back. We'll have a further discussion on it, and I'll let you know whatever comes out of that and give you a statement. So that is it. That's my report.
All right. Well, thank you. I think we would certainly appreciate it if if more time and consideration could be given before anybody gets laid off. And I mean, I mean, the nurses were taken by surprise. Of course, we were taken by surprise that there would be discussion about layoffs at this juncture. So we would hope that maybe the hospital would reconsider and at least delay any action and maybe try to figure out another way to deal with whatever the pending issue is.
Yeah. Listen, I wholeheartedly understand. But again, there are, many pressures that are, external that we, as an institution really have to deal with. Not only, the reductions and the administration has put forth, but also, a lot of our supplies and things don't come from here. So we also are looking at those pressures as well in terms of, those tariffs and what that means for, both medical supplies and, capital related issues. So, but I do understand.
All right, but if in fact the hospital is enjoying a fairly good profit, maybe you could take a less of a profit and keep the money within the invested within the institution.
Well, Steve, as a not-for-profit, that's exactly what we do. The whatever profits there are is circled back into the institution. So, but I understand your concerns of these layoffs and what's happening, in our community.
All right, and in terms of the rehab unit, as far as we know, there's still been no state action on the application to reduce the size of the unit
No.
from 16 to 5 beds.
Right, there has been no action on that yet.
And what I'm told, by the way, I made some separate inquiries about it, is that it's still accepting patients until told otherwise. They've been operating as normal. And then there's something here about, we heard that the hospital is shutting down the ED overflow unit and that the ED numbers are down due to the recent changes with EMS. So this is no longer about ED overcrowding. Do you know what that could be, what they could mean by that?
I do not know, but I mean, the census at the ED continues to be very high. I get calls all the time from folks that are in the ED waiting to, either be admitted. And, the census at the ED continues to be, more than usual. So, but I'm not sure what that statement, what that ED overflow they're referencing to.
Yeah. Okay.
Yeah. I mean, also, Steve, before, sometime this week, if you could also send me the information for the Lieutenant Cornier.
Yes.
Because I'm very interested in knowing exactly what this, time, excess time is, and have a discussion, and also maybe have a discussion with our EMS, the emergency department to sort of look at this further.
Yeah, I think it would be good if there was a meeting between your emergency department and the captain at EMS.
Yeah.
And to try to work something out, because I'm surprised the situation seems to be getting worse. I thought it was improving.
Yeah.
That the idea that the turnaround time is now up to 40 minutes. That's like it's 25% worse than it was when we first started looking at the issue.
No. So we're certainly willing to look at it, and I want to be able to, sort of bring the EMS folks at with the lieutenant and our EMS administration to see where is it the disconnect is. So
yeah. I'm going to give you the information on the captain who's above him, who runs the EMS station.
That's fine. Sure.
Captain Glenn Taylor.
Okay, that sounds good.
Okay, very good. Okay, thank you.
Thanks, Steve.
All right. Next up, if he's still with us, Diego Quintuna. Diego?
Good evening, everyone. Can you hear me?
Oh my gosh. Diego, welcome. I know you sent us a report in advance, but maybe you want to run through it for us?
Yes, of course, of course. Again, good evening, everyone. So,
But by the way,
yes,
you get
go ahead.
you get like A+ on that report. That report is beautiful. The layout and all of the information that's contained therein. That's you do a great job.
Oh, thank you. We had to revamp. So thank you, Rick. Much appreciated. September's gonna be a whole new photos, so coming soon.
Okay.
Okay, so just to go over the report real quick. So, the first three are just recent research articles that the university has done. So the first one is the burden of coexisting hypertension and type 2 diabetes in US adults is increasing. So this is a new study by researchers at the Women's School of Public Health. They reported that US adults with both hypertension and type 2 diabetes, they face a significantly higher risk of all-cause and cardiovascular mortality compared to those with only one of these conditions. The next study, which finds significant declines in maternal mental health across the US. So this new study reveals a concerning decline in self-reported mental health among mothers in the United States between 2016 and 2023. This study was conducted by researchers at Columbia University Women's School of Public Health as well. And this study found modest but measurable declines in self-reported physical health during the same period. So this is a cause for concern. Another one involves sitting, which increases heart risk for patients with chest pain. So patients who worked more than 15 hours of daily sedentary behavior on average were twice as likely to experience more heart trouble or die in a year after discharge than patients who accrued a daily average of 12 hours of sedentary time. So you can see like a few extra hours increases, more heart risk for patients. And then coming back to our other committee updates and events. So we did host an event on May 10th, which was the medical students, they led an inter-school health fair. So Vagilos College of Physicians and Surgeons students, they organized this health fair, bringing more than 120 volunteers and serving over 500 Washington Heights community members. So this was in partnership with New Presbyterian, and the fair highlighted shared institutional commitment to serving the Washington Heights community. And they offered essential health screenings for hypertension, diabetes, and kidney and liver health. And I also included the link in the article. And we have an event coming up on Saturday, June 7th, the Cerebral Palsy Community Day at Haven Plaza. So this is a free community event dedicated to cerebral palsy. Admission is free with lunch and giveaways included. In case if it rains on June 7th, the rain date will be on June 8th from 11 a.m. to 2 p.m. again at the same location at Haven Plaza. The Columbia is also hosting a dining job fair. So Columbia University will be hosting this job fair on Thursday, June 12th from 9 a.m. to 12 p.m. at the Lisi Bollinger Forum. This is in the 125th campus, Manhattanville, if I'm not mistaken. This will be a great opportunity for job seekers to learn more about the various roles available in Columbia Dining, and they can ask questions directly to the hiring managers and HR. And I included the RSVP link on the report as well. The Haven Plaza Farmers Market is returning. It opened on June 3rd and will run through December 23rd on Tuesdays from 8 a.m. to 4 p.m. at Haven Plaza at 168th Street and Fort Washington Avenue. The STEM Quest Create Your Own Path event also returns. So this program is through the Columbia Vagilos College of Physicians and Surgeons to the state pre-college enrichment program, SPREP. So this event explores STEM and healthcare careers, and it will also include interactive workshops for pre-college students. So there will be giveaways and free snacks, and will be held in person on June 21st from 11 a.m. to 2:30 p.m. at 104 Haven Avenue. And I also included the person to contact to RSVP, Kayla Reyes, on the report. Hike the Heights. Some of the student doctors will also be participating in this event. And this is this Saturday, June 7th, 2025, from 11 a.m. to 3 p.m. at the Sunken Playground at Highbridge. And two more updates, the Sing for Whole piano. So as part of the Sing for Whole pianos program, this artist designed pianos are placed in local parks and public spaces, free and open for everyone to play. And, sharing the joy of music with the community. And the piano will be at Haven Plaza from June 10th to June 30th, from 10 a.m. to 6 p.m. And last but not least, Columbia also has outreach and screening. So in collaboration with clinical departments and Columbia community partners, Columbia doctors provide healthcare education, free health screenings, and more. And I also included the link there with various dates that are coming up in the month of June and July. And that's all for my report. Thank you so much.
Well, thank you. And you included, when you sent the report to us, you included, I think, 4 or 5 flyers for some of these events, which I passed on to all of our committee members. I could also forward them to you, Mary, if you don't have them.
Yep.
Newsletter.
Yeah. Yeah. We should send it out to the whole board list.
Yeah, let me send it.
Yeah, please. Yeah, we'll send it out to the whole board.
Perfect. Thank you so much.
All right, very good. Any questions, Mary?
How does the community get this information? There's nothing ever posted, at the plaza. It's nothing in the local newspapers or anything like that.
Well, we don't have.
The plaza for public.
We don't have.
community,
Is there a bulletin board or something at the Haven Plaza that where you can advertise the events taking place there?
I don't think there's a bulletin board at Haven Plaza directly. There is one inside one of the buildings. I keep forgetting the name of the building, but I'll get the information to you. But we also send it out to Carmen De La Rosa's office, Robert Jackson's office, and other elected officials. They also posted in their weekly newsletters. And we're still trying to do outreach to other community partners that have newsletters and try to get that information out there as well through them, through our community partners as well.
All right, but it might not be a bad idea to have the old-timey bulletin board so that people who are walking past can see what's happening at the Haven Plaza.
Yeah, important specifically because some may, I don't know how many, but people that do not have computers or just all sorts of reasons. It's better to expand the way you advertise as opposed to limit yourself to just an email.
Yeah, of course. I'll definitely look into that to see how we can better promote it around the plaza. So that's a good suggestion.
Do you have security there around the clock? Is there somebody stationed there all the time?
Haven Plaza,
Yes.
like 24/7.
Yeah.
I'm not too sure. I think only during like early morning to early evening hours. But I could find out for you if it's 24/7.
All right, because the piano, I assume the piano is going to be locked up, so nobody's playing it at 2, 3 in the morning.
Yeah, I think so.
Yeah, I mean this piano program is fantastic. They're beautifully designed, and they all have some artwork on them, and they're placed all around the city, and people can just sit down and start playing on the piano.
Yeah, sure. And we're also trying to get like local artists to come and play as well, do some small performances. So we're looking into that as well.
And then, I don't know if you mentioned it. There's also, I think, a jazz concert scheduled there for Monday evening. The Langston Hughes, the second quartet, I believe.
Yeah, I didn't receive a flyer from that yet, but I'll send it to you first thing tomorrow.
Yeah, I think I may have received one from Marty Collins.
Okay, I'll resend it to you just in case.
Okay, very good.
Thank you.
That should also be on the community board's newsletter. Did you have something else, Mary?
Well, I was just gonna say, I've been saying this beginning, since the Haven Plaza opened, that we made a way for the community to find out what's going on there. The only way to find out is happen to go and buy it.
They should have some kind of screen or like a post or something
Yeah.
with a screen.
At the
Right.
park, they have
Right.
like a bulletin board
Right.
that's enclosed.
Yep.
Yeah.
And they post them. So why can't that happen there?
Yeah, well, well, he's gonna take the recommendation back.
Thank you.
All right, very good. Thank you, Diego.
Thank you.
All right. And last but not least, Diane Ashley, Director of Marketing and Communications from MJHS. How you doing, Diane? We actually haven't seen you.
I am tired.
Oh, well,
Like the rest of us.
but we're gonna let you go to sleep very soon.
Yeah, well, hopefully I'll be closing out this section of the meeting with good news. All zeros. No COVID, no flu, no RSV, no anything.
So you're telling us you're just a big zero.
Well, I hope I'm a little bit more than that. We actually had a very good time. We were very involved with the senior resource fair today, and so it was a terrific event. Yes, I did wilt, just so you know.
I told you not to.
I know, but the 90 degrees got to me. But anyway, it was lovely being out there and supporting the community. And I know you got a little bit of an update on that already, but really a terrific event. So proud to have been part of it.
Okay, well,
and appreciate the love and support we got for our 150th anniversary. So.
Oh, fantastic. Very good.
Thank you.
Is there an event planned? Did we already miss it? Celebrating the anniversary?
There is not going to be a gala or anything. We may do some more. We did a little bit today, but sort of all of the dollars being as tight as they are, we're not planning a lot of big events.
Oh, that's really too bad.
I know. I hear you.
I mean, there's
I
a
hear you.
150th anniversary doesn't come along every year.
No, it doesn't, and it was lovely, and thanks to the support of the community, Senator Jackson did a resolution on the floor of the Senate, and we got a proclamation from him and from the borough president's office, Mark Levine. So that was lovely.
Well, we should do something. Let me talk to you separately. There's got to be something we should do.
Thank you.
Like what?
Something.
He's going to send a fruit basket.
Something. I don't know. Something. Maybe you come to our general board meeting or something, and we salute you. I mean, we can't. You can't just let the 150th anniversary go by the boards.
That's very true.
Anyway,
all right.
Thank you for your support, and obviously pleased to be reporting that the numbers are staying down. So
yeah, well, that's very good. Congratulations.
Thank you.
All right. Next on the agenda, I put down that we should have a follow-up discussion about noise in public plazas. We had a public hearing that we participated in last month, and I don't think we should have. We should just let it go by the boards and not do any follow-up on it whatsoever. I mean, it's still a real issue, and we shouldn't just be blowing hot air and not following up and doing anything at all. My initial thought was that we should at least do a resolution. I was hoping that we could work it out so it would be a joint resolution with the Traffic and Transportation Committee, dealing with, I think, two of the issues that came up during the course of that hearing, which is that there should not be back-to-back events at some of these plazas. Right. That people who are living there should have some relief from having constant amplified sound outside their windows. I did ask Ebenezer to get some information. We got a bit of information from the Street Activity Permits Office on permits that have been issued this year for the plazas. And there was one weekend, May the 3rd and May the 4th, where there were back-to-back events at the Plaza de las Americas at 175th and Broadway. And the people who live there, I think, have been constantly complaining about loud noise from that plaza. So I think at a minimum, it's not unreasonable to say that if you issue a permit for a Saturday or a Sunday, you shouldn't also issue a permit for the other weekend day. You know, give people some relief and a chance to relax from all of the amplified sound.
I agree with you, and I want to add that if they are, I agree with you about the Sunday and then followed by, Saturday and then followed by Sunday. But if you're already giving, like, let's say a Saturday this weekend and a Sunday the following weekend, that should be only summertime, and during the fall, winter, are there any events happening? Anyone schedule any events happening during the fall and the winter?
Well,
so there should be none. That you should.
I mean, it's a public plaza.
Yeah.
So we shouldn't make it so that there's no events.
Well, but
there's-
if we said that, if we can't say that they should not have any events, then we can't say anything, right?
Well, no, I
mean,
think we should say something like we shouldn't have events back to back. I
Yeah.
think that's really
Yeah, I
important.
think, yeah.
But you should
Oh,
define
yeah.
that. What does that mean? Back to back, like.
Well, but
every
both
Saturday
both
and Sunday?
but both weekend, whatever the weekend is,
Uh-huh.
both days
Yeah.
should not have loud events. You know, people should be able to relax and get some relief.
Right.
And my feeling is that 4 hours of constant amplified sound should be the limit. That 4 hours to me is enough.
Is enough.
And going on for 6 hours or 8 hours, that's overkill. That's
I agree with you, and I would
Yeah, I
add
agree with
that the residents of our district are not the same kind of residents that go to the Hamptons,
Yeah.
in the area. No, because there is the open street events during the summer, and Park Avenue is one of them. There is a section about, but it doesn't bother the residents of Park Avenue because they're not there. So in our case, the summer time off sometimes related to, okay, I go to the park and I do all sorts of things locally, but it does not involve people that move, going out of town to relax. That does not exist in our district. Nobody's really, really, really relaxing. And there is some, while I talk about it, there is some health effects to this. People that don't leave the city and all that, but it's.
To that point though, too, like, not just people leaving, but newer houses, newer construction, windows are better equipped to deal with that sound and that noise. And our buildings are older up here, that we don't have the same windows. And I know that we're probably not going to get anywhere by talking about grant money in this current state of things, but like, if there were some sort of program to help with retrofitting older windows for newer models that are better at dealing with sound noise, that would be great too. But I think at the very least, not having Saturday, Sunday events in the plaza is a great place to start. And like, one other point, and then I'll quiet down here, like, the whole public hearing was supposed to be about noise in the neighborhood, period. And obviously it focused on one particular issue, which is great because that's obviously a community concern. But there's so many other aspects of noise in the neighborhood that we weren't able to address in that meeting that we should definitely keep following up on.
Yes.
I recognize that that's the one folks are concerned with because it's right in their faces. And
Yeah.
and really, I think it stems from trying to use the public plaza as a concert venue, and that's just really tough. But anyway,
Yeah, that's,
I
yeah.
digress.
Yeah,
I
that's-
just need to say all that.
Yeah, no, you're right. No, you're absolutely right. We don't pay enough attention to the noise issue. But
I mean, that's the reason that we had no music, really. We had, some, the soccer music.
you're at your event today?
Concerned about noise.
Mm.
Have, the parks, band or whatever with the stage and, all kinds of, loud, music and introductions, people speaking and whatever, but it's a lot of noise.
You had that at your event today?
No,
Oh,
we did not.
Oh.
We decided not to.
You know, a thought just occurred to me is like when businesses come before the licensing committee, they have to give a report about from the 33rd or 34th precincts about any issues that are related to noise. And are there particular events that are being hosted that are repeat offenders that are particularly egregious, particularly noisy that we can look at as some, you know, particular problematic things that go on? I don't know.
Well, I think the problem with these events in the plazas is that they are not necessarily sponsored by one individual restaurant or bar. So you can't.
No, but
you
who's
can't.
applying for the permit is my point. Like somebody at the end of the day is responsible for that permit.
And just on Jacob's point, one of the things that we did discuss, that there's no clarity on when these permits exist, when they're issued. The community is not notified. So one of the things that we discussed at the hearing, which should also be in the resolution, would be to have, again, to Mary's point earlier, some sort of bulletin board or there that shows the permits and upcoming events. I think that that would be very helpful through all of those.
I think first can get those permits.
Right.
On time.
Well, I don't know. I asked him a month ago to get me a list of all the permits that were issued for the plazas, and finally at the end of the afternoon today, he got me something. But I don't think this is a comprehensive list because it only runs between April and June.
And to be fair,
Yeah.
they're not publicized on like the city website. It's not like open data or anything like that.
The district manager gets them and we get them in advance. So one of the things we talked about in our traffic and transportation is we can also send this information as an FYI as we do a newsletter.
Yes.
These are events going on at these public plazas.
Yes.
So all of these things could be listed. I'd also, since I'm on both committees, I'd love to work on this resolution.
Yeah. No, I think this information should be in our newsletter.
Right.
When we get wind of these things.
Kathy said she was open to that.
And there was a link that he sent me, but I wasn't authorized to use the link, so I couldn't. I don't know what was behind, what other information I could have gathered.
So one impression that I got from the hearing is that obviously there's the issue of permitted events, back-to-back permitted events, but also unsanctioned noise production at the plazas. And one thing that I think was unfortunate that one of the precincts was not at the hearing is because that is an enforcement issue from the department, right? So if people are unsanctioned bringing a speaker and blasting music at 3 a.m, that is NYPD's jurisdiction to give a ticket. They can seize the speaker as arrest evidence or evidence of a violation if they want to. If it's a car that has like a speaker system, they can seize a vehicle for that purpose. And so I just feel like I need to express that I'm disappointed that I think it was the 34th that wasn't there, because one of the most like salient plazas is in their jurisdiction. And again, if it's just as much about people, coming and making noise as it is about permitted things, that is an issue that they are empowered to address. And the 33rd precinct made a pledge at the hearing to be more on top of it, and that they have people, they have officers patrolling and whatnot. So, I think that that's important too.
Yes, it is.
Yeah, that is a very good point.
Yeah.
All right, so are we in favor of doing a resolution?
Yes.
Okay.
For starting a draft.
Very good.
Superstar.
All right, very good. Well, then we got.
I'm on both committees, so I've been hearing about this back to
Okay.
back.
Well, then you're particularly suited. You're particularly suited for this. Okay, very good. So, is there a motion?
Are we trying to pass this now, or are we trying to do it in September?
Well, September is too late, isn't it?
Yeah.
Yeah.
I mean, this is well, I don't need to say it's an ongoing issue that we should just wait in September, but it will doubtlessly not still be an issue in September. I don't know.
Right.
But it seems like we may have we had this public hearing.
We don't want it to die out.
Yes, we should do something.
Yeah.
So did you have something else?
No. Are you talking about the resolution, right?
Well, I thought you had something.
No, I didn't have anything.
Okay, fine. Okay, all right. So is there a motion that we should pass a resolution with the 4 points that have already been
See ya.
Take care.
Thanks for joining us.
Motion?
Yeah, yeah.
You have to make a motion.
Well, the motion is going to incorporate the 4 points we've mentioned here. No back-to-back permitted events on weekends, 4-hour limit on amplified.
Back-to-back events.
On weekends, whatever. A maximum 4-hour limit on amplified sound, on constant amplified sound. 3, posting notices of the events on a bulletin board.
Ahead of time,
Well, yes, in
Well,
advance. Okay.
not the day off.
Okay, no, not on the day of.
Substantially.
In substantial
Okay.
advance. Very good. That's a good word. And 4, we call upon the NYPD to take enforcement action against any unsanctioned events. Well,
Wait,
but
is that supposed to be,
yeah, I don't know how we can do it.
yeah, no, but we can,
Wait, what do you mean that you don't know?
It's because the traffic transportation already met.
right,
Yeah.
when
Exactly.
can Leo take a decision?
to that exact. Leo's not gonna say no.
All right, well, let's talk to him.
Okay, all right,
Okay.
so I second your motion.
Okay, very good. And are we ready to vote? All those in favor, but please indicate by raising your hands. That's 5 in favor. That's the entire room. So the motion passes on a vote of 5 to 0. Okay, next, old business. We have some recycling statistics. The latest statistics available are from February of this year, indicating that our diversion rate on recyclables, 16.3%, which was a very, very bare improvement over 1 year ago in 2024, when our diversion rate was 16.2%. So we're still in this middling area below most of the other community boards in Manhattan. On the DEP service requests, for the month of May, 4 of the top 5 service requests were basically complaints involved, surprise, surprise, noise. And so there were 109 of these noise complaints. 39 involved alarms, 34 involved construction before and after hours, 19 involved barking dogs, and 17 involved construction equipment. So noise is definitely, as we've said all along, a prevalent problem in our community.
See, one of the things I saw on this report that you shared with us was the request, like residential lead kits.
Yes.
Request.
Yes.
Can we have someone come and speak about that at some point? I feel like I recall this, and correct me if I'm wrong. At some point, this district had maybe several years ago, about double the national rate in lead.
Even lead poisoning?
Yeah. We did have years ago, and I was heavily involved in that issue. We did have a significant problem with childhood lead poisoning.
Yes.
But the latest statistics I've seen indicate that it's gone way down. But we should get an update.
Yeah,
Absolutely.
but I would love to
Yeah,
hear a lot about that, especially
Well-
because it's the third highest thing. I
Yeah,
mean,
yeah.
I didn't even know that people could request that.
Yes. Well, basically, I think people are doing that to test their water.
Right.
But what?
We should get an update.
Yeah, we should get it. So actually, that's a good question for Pauline. We should ask her, we can contact her and ask her for the latest health department statistics on childhood lead poisoning. But also, when the DEP commissioner comes before us, hopefully in September, we could also talk to him about the lead and water issue.
Yeah, but water is different than lead paint.
Yeah, absolutely. Oh, yeah, absolutely. Yeah. But I'm pretty sure that these lead kits are people are seeing that they have discolored water, and they want to test the water to see what it might be.
I've never done that. I should do that. My water looks all types of colors.
That sounds scary.
Okay, but my understanding is generally if you let it run for several minutes, it's usually okay.
Plus, if you don't look at it.
Right.
Yeah,
I love that. Love that approach.
or if you're mixing with chocolate syrup. Okay. Next, OC, do you have an update about the ASPCA?
So, first, we're gonna get a short presentation in September,
Nice.
finally. And so from the ASPCA about the number statistics, that's what I asked about statistics. My understanding, they had 9 events that include spay neuter, but also wellness vaccination. So it wasn't all spay neuter, which is fine. It's great.
There are 9 events in
Nine
our community?
Yes. And so remember, it was only supposed to be like 4. We got
Yeah.
like a surprise, and then I added more. They added more because because people kept asking for services.
Yeah.
My understanding is that there is one location is problematic because people are not even canceling it. They have a lot of no-show. So, and that is on 10th Avenue where the NYCHA housing development, for whatever reason, that location get the most like no-shows. So my understanding from him that they are from the representative of the mobile van program, that roughly speaking per event, they service anywhere between 20 to 30 animals, pets, okay, dogs and cats. That's considered a same, they get like around 30 in the clinic itself. So that's fine. That's fine. The problem with the lower number is that it's not because there was not available slots. It's because people are not showing up. So I don't have the specific like per event and location. That's what I want him to bring to our September meeting. So, it's great. It's a good start. But it's just, obviously I want more services.
Would it help if they park the van like right next to one of the dog runs?
Yeah. So they're trying to find locations that are visible to the public, so people, hey, you're doing this, that, start communicating.
There's a lot of foot traffic.
Right. And what they did the last time when I announced that at the general meeting, the May general meeting, is that the person that's responsible for running that said, like, listen, people can just text us anytime to that number, fill the questionnaire, it's not always a spam thing, and then we can plug them in, even if it's not in Inwood, because they ran other vans in different areas, right? So, I mean, I was like, great, maybe somebody can go to Harlem at that particular day when we don't have an event here in Inwood or Washington Heights. So I don't know yet. I don't have the numbers. So that's what I wanted to bring in September. And so he's only responsible for the mobile van program. Okay. He's not gonna, the discussion about how can we get more services, I think have to also include the people that's responsible for where are they going to build a clinic, or maybe we could share. My idea was to share at least wellness vaccination clinics with the Bronx, because the Bronx they have wellness vaccination clinics twice a week. Okay, so if we can get 1 day a month from them ongoing throughout the year, maybe I don't know if people will travel to the Bronx, but then again, I don't want to, I don't know.
To the Bronx.
100 East, 3rd Avenue and 161st Street. It's South Bronx.
That's not that far.
It's about 20 minutes drive. So, but
It's a
I think they can, well, my point is like, if they can just start plugging, people are calling and don't mind showing up, or just continue the mobile van here, which is better.
Let's see, so I'm not sure. So is this a good turnout? Would this be considered a good turnout? And if so, does that mean that they're gonna keep coming back? Like, is this sufficient enough for them to be like, listen, people are using the services, we do want to come back? Or was that one particular problem area going to be an
So,
issue for us?
in terms of the problem that we have in our district is compliance. In terms of the no-show or cancellation, right? So the problem is not the number of people, that's why we got so many
Right.
clinics. The problem was the compliance. So it's like, I have a problem with it, I mean, like, people don't show up, whatever. So we have to think about how can we fix the compliance part.
They don't serve, well, I guess dogs that have, not registered, what's the name?
Oh, you mean the license they have?
License, yeah.
No, no. They service,
It doesn't matter?
it doesn't matter.
Oh, okay.
It doesn't matter, you show up, and,
Okay.
no, you don't want to deter people, no, they service that's not, because it's a state registration, it's not related to the ASPCA.
Well, isn't the licensing done at the city now?
I think it's a state. It's not related, ASPCA doesn't do licensing.
Okay, fine.
That's not-
Okay, it's not their concern. Okay, very good. Okay,
So, we'll see.
okay, very good.
Yeah.
All right, so all in all, it's a good report.
Yeah, and congratulations. I mean, that's really exciting that you got, frankly, the amount of people that you did. I realized it would be better if there were more, but I think that's commendable.
Thank you. I
Yeah.
really, it's helping me tremendously too, because it's off my list. Yeah,
It's very awesome.
thank you.
About it.
All righty. So any other old business? Well, sort of, yes.
Oh.
But I've been discussing with the Christine Das Romero, who runs the Lower East Side Ecology Center, about doing another e-waste collection in Inwood. She tells me that she can't do it in the spring, but she is planning to do it in the fall.
You mean can't in the summer?
Um,
Spring pass, maybe or something.
Yeah, I don't know why she skipped over the summer, but we certainly need to help promote it and get the word out. So the fall might be just as good. All right, is there any new business?
Sorry, how do we dispose of batteries? What's the proper word to dispose of batteries?
So,
I feel like it's a-
if it's alkaline batteries, you can toss them in the trash.
In the
Sorry.
trash.
Anything else, and there are numbers, you can go on the website, like what kind of batteries are, the rechargeable for sure. And then there is a different type of batteries that need to be recycled. And Home Depot will take,
Oh,
okay? Staples
Staples
will take, as long as they're not, not the alkaline one, it must be rechargeable and whatever, something else.
The alkaline can-
Yes, and I think Best Buy, if I'm not mistaken, but
Yes, I
somebody
think you're right.
check
I
that.
think you're right.
But we don't have as many
And
places. And the
yeah,
e-waste collection, I think they can take batteries too. If I'm not mistaken.
they may, yeah, I think that makes sense. All right, any new business? None.
There's probably like a motion.
Well, are there,
One more thing before you go to the
are
motion?
there any announcements?
Yes, and no, it's not an announcement, but I don't know what is it really, but I'm just gonna say it. We should have at least 1 or 2 environmental topics in every meeting. I know I said it before. And we are plugging here.
I know.
Important.
I wanted to have the flooding presentation today, but
Yeah, but so something else from the health had to be going to in September
yeah.
to leave something. I'm just saying, when you put
Okay.
the agenda together, please, at least 2.
Okay. Well, no,
I think we should cap them
noise.
at like at least at most 5.
Total.
Yeah,
Okay. but I'm
total,
telling
and
you-
then at least 2. So
Okay.
like maybe half and half.
Okay,
Well, noise is an environmental issue.
that's
That's
correct.
fair.
Okay.
That's
That
fair.
is true.
Okay, I take it back.
All right, very good. All right. All right, so at 9:53, we are adjourned.
Hey.
All right.
Why don't you let us motion?
You guys online, I don't know who is that.
Just say that that's out of order.
Well, fortunately, he's not here.
Motion for.
All right, thank you all.
Can you not, where's the links that someone
Oh,
posted
yes,
on
sir.
there? Yeah,
Yeah.
yeah.
You have them?
Okay, they have them posted because I was interested in getting them. Thank you so much.
Right. Yeah, Ross's links, whatever.
Yes. Yes, I have Ross's links. I have all of Diego's events.
Great.
Their links.
Star.
All of Pauline's links. I have all the links.
One day I wish